He's organizing the furniture, Mr. Chong.
Good, Aaron.
Good morning. Want to call to order the November the 14th, 2017 meeting of the Sacramento County Board of Supervisors, and we want to welcome you all here. I know we've got some presentations, and we started off with a fire drill, and hopefully that'll be one of the highlights for getting the meeting started anyway, but we've got some other highlights, obviously, in recognizing a number of you for your contributions, and we have a number of reports as well, and a fairly full agenda this morning. So with that, again, welcome, and I'll turn to our clerk to make the announcements, and then we'll do the Pledge of Allegiance.
Supervisor Cerna?
Here.
Kennedy? Here. Peters? Frost? Here. Natoli?
Here.
And you have a quorum. This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the Local Government Affairs channel on the Comcast, Consolidated Communications, and AT&T U-verse cable systems. The meeting is closed caption and is webcast at www.sacmetrocable.tv. Today's meeting will be repeated Friday, November 17th at 6 p.m. on Channel 14. A DVD copy is available for checkout from any local library branch. Members of the audience wishing to address the board may fill out a speaker slip and hand it to staff. When the chair calls your name, please come to the podium. Also, please silence your electronic devices at this time.
Good. Well, thank you. I don't have any forms. I know we got a little late entry in here, so if you do wish to speak on an item, I know some of these are timed items and you're here for those specific items, but if there's any item, particularly on the consent calendar, that you wish to speak to, please get a form to either Stephanie and Renee up in the back or to Flo, and we'll call upon you here in a few moments. So with that, Ms. Newton, if you'd lead us in the Pledge of Allegiance, please.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Turn to the clerk first. I know a couple of items that you wanted to call out, so.
Okay, for your consent matters, items 1 through 29, you also have an off-agenda item. On the off-agenda, it's the resolution supporting the submittal of Proposition 1 grant applications administered by the Sacramento San Joaquin Delta Conservancy, by the Sacramento Valley Conservancy, and Ducks Unlimited. I do need a motion first to hear the matter.
Okay. Chair would move.
Second.
Moved and seconded. Please vote. Necessity to hear.
Unanimous vote.
Okay. And I would just note, I want to thank our staff for preparing this. There's a deadline of actually submittals by November 30th, and since this is the last meeting for November, we were going to run out of time, so I know there was a scramble over the last couple of days, so thanks to Michael Peterson, Michael Penrose, Don Thomas, and anybody else who was involved in this for helping with this. So I would move the off-agenda item.
Okay.
Move. Okay, please vote.
Unanimous vote.
Thank you.
And for your consent matters, items 1 through 29, you are adopting an ordinance for item 18, an ordinance amending chapter 16.80, 81, 83, 84, and 87 of the Sacramento County Code relating to payment of development fees through the statewide community infrastructure program. You waived reading on this and continued today for adoption.
Okay.
And that's all that I have for your consent matters.
All right, turn to my colleagues to see if there's any items you want to pull off the consent calendar or comment on. Supervisor Peters?
Yes, I'd like the record to reflect I'm recusing myself from items 18 and 19 due to potential conflict of interest.
Okay. Supervisor Frost? Okay. Ms. Kennedy?
Comment on item 16.
Okay. I'm on item 16.
Item 16, authorization to execute an amendment to the revenue agreements for law enforcement rotational tow services to reduce the referral fee from $50 to $25.
Great, thank you. Mr. Chair, members of the board, I just wanted to make a brief comment here. It's not substantive to the actual action in front of us, but it does remind me, and I suspect it would remind others on this board, about some of the challenges we're currently facing in each of our respective districts when it comes to towing contracts and towing activity for RVs and boats that are derelict and the subject of code enforcement activity. As I discussed, and perhaps you all as well did discuss with our CEO, this is something that we are continuing to express concern about, especially hearing from some of the tow companies that feel that it's extraordinarily expensive for a variety of reasons to tow these, especially the RVs, from residential neighborhoods that have been abandoned or otherwise derelict. And I think it's incumbent upon us to perhaps get a report back or understand from the appropriate executive personnel what we're doing to help expedite the agreements that need to be in place with various towing companies to make sure that we're responding timely to our constituents' needs to have these types of RVs and boats removed from residential neighborhoods.
Mike Penrose, our Deputy County Exec, is going to speak on that. That is an item that I think all districts have mentioned that to us. It's a pretty important item for us. And Mike?
Good morning, members of the board. In the context of the towing services contracts that we have in code enforcement, which is why you're making a distinction between this item and the other item. We currently do have a contract in place that does deal with abandoned RVs in the public right-of-way. It's a very expensive process, and it's one that we're continuing to look at ways that we can improve the response times that we can apply to getting those out of the right-of-way, because there are certain constraints, as you know, in terms of noticing and all those things. The one area that we don't have a good solution in yet, and we're beginning to see what we can do from a contract perspective, is dealing with the boats. In the public right-of-way, it's a real challenge. Right now, there's not a good, clear assignment of who has the responsibility for dealing with that, as well as getting those picked up and then cleaned and stripped and handled in a way that you can dispose of the boat. So it is an area that we're looking at how we can improve that, but we currently don't have a great solution for that from a towing perspective.
So Mike, let me make sure I understand. We don't have, it's not codified enough in our code enforcement regs about boats?
No, it's not an issue. It's not an issue of the right to remove the boats from the public right-of-way. Okay. It's the mechanism. If you get a boat that's on a trailer, we can hook up to that and get that towed out.
But we're finding boats that are not
exactly,
on trailers.
And that's one of the challenges. So that's why I'm saying we are trying to, within the county, identify the best method that we can deal with the right to pick it up and dispose of it, as well as the way to collect it, right? To actually get it, and then there's some disposal issues associated with hazardous waste and other elements that are tied to boats. So it is something that we're working on, but we don't have a great solution for it right at this point.
As we get closer to having a solution, this is an item that's been difficult for us to get a solution to, but we will communicate with each board office and come back to the board if we need additional monetary authority at this point. That's part of the issue we're running into. Who's going to have the contract to help tow these things away?
Well, I was going to suggest that maybe after the beginning of the new year, or perhaps as a subject matter of our retreat that's coming up, might be something we want to delve into comprehensively, not just the towing item. I mean, I think it's fair to say all 5 of us are seeing more code enforcement violation activity, and I would just like to have a better understanding, speaking for myself, about what it is that we're doing to adjust our enforcement efforts. What is it? What is some of the messaging that we should be responsible for delivering to our constituents about what we are doing differently, and perhaps the application of new resources, and not to give them a false expectation about doing a lot more soon, but I want to make sure I'm accurate with my constituents when they express their concerns about why the RV hasn't moved for a month. I want to have a good answer for them.
Understood.
Okay.
Yes.
Supervisor Peters?
Mike, I know you haven't been in charge of this for very long, but this is a subject that I've been talking about for 2 or 3 years now, particularly related to RVs and the disposal because of the waste that's left in the RVs primarily. And I think on those, it's really all about the money. It used to be that the guy that was towing it could get recycling fees at the other end, and now that is not it's just not working for them. They're not getting the kind of money they need. So we may need to come up with a monetary solution from the county, because it has been going on for some time. Now you've got homeless people sleeping in RVs, but in addition, people get tired of their RVs, they get old, they get broken down, and they just leave them, and it's full of icky stuff. And I think we need to come to a resolution on this sooner rather than later.
Understood.
Thanks.
I'd just like to weigh in, too, that it seems to me that we've got the ability maybe to address this more in-house than not. Obviously, the Kiefer landfill, you have to properly dispose of materials, but we have a facility out there where we take in a whole lot of different types of products and handle them appropriately and make sure they're disposed of properly. And it seems to me that maybe we need to convene quickly, but maybe briefly, a task force and get solid waste involved, code enforcement, obviously sheriff and CHP. We dispose of boats. We can take them out of the rivers and waterways. We don't do it in great numbers, but there's the ability to do that. And I just think with RVs, because I can tell you what happens in rural areas, if they sit there very long, then guess what? They get burned, and they certainly either get stripped or they become the object of attraction for more dumping, and so I think, again, our folks are certainly working hard to be responsive, but it's an issue of blight in our community, and it's inappropriate behavior, and if we can, follow up with folks and certainly hold them accountable, that's one thing, but a lot of cases, that's more difficult to do than just disposing of it properly. So, again, I don't know what sort of resources it takes, but I believe that we have the ability to, if nothing else, remove them quickly. Not that we want to be storing anything out at Kiefer or anyplace else, but I think we have the ability to get them out of our roadways to get, not become an attraction for other types of activities. And so I'm going to suggest that maybe even sooner than the board retreat, that you come back in January with at least who you're going to convene, and Mike, maybe you head this up, or you get the sheriff involved, and like I say, some of the other agencies, but I don't know if it's a resource issue, or if it's a combination of things, but leaving them for days and weeks and months in some cases, because we don't have any mechanism that, and we're challenged by that, time's come for us to kind of figure that out, and I think we have the wherewithal to do that, so I just would offer that. So I don't know, Mike, if you have any comments?
The only thing I'd like to share is I don't want you to be misled to believe that we're not dealing with RVs. We're towing somewhere between 5 and 10 a month currently under the current contract, but there are a number of related issues, some of which you've articulated in terms of disposing of these, as well as notification rights and a number of things that go with being able to remove them from the right-of-way. But I understand completely what your request is, and we'll be able to respond.
And Supervisor Frost?
So it's not just the cost associated with towing. It's not like we can just give more money and they can tow more vehicles.
That's one of the elements that will help, but it's not only that. Yeah, it's resource. You've identified a number of the issues that are related to dealing with both RVs and vessels in the public right-of-way.
And sometimes it's on private property, but it looks like it's on public property, and we can't, we don't deal with it if it's on private property. It's the owner of that property that has to do something about it, and they may or may not be motivated to do that.
What is the cost differential that the towing companies are saying we are paying to get rid of the RVs? What are they paying to get rid of the RVs?
I don't have that number with me today. For us towing them, it's significant. It's on the order of thousands of dollars to have them towed and removed from the right-of-way. I don't know about the back end as it relates to the towing company.
Well,
I can get that information.
And it's also a toxic removal disposal cost as well, right?
So as we refer this to staff?
Yeah. Yep. Just get a report back and maybe do it early in January with at least, some of that data, the information, kind of where you think you're headed with this, and let's do it quickly. So, okay. You want to suggest any particular date for report back?
Not at this point. We will communicate that back to you.
Okay. For first month of 2018, though.
There you go. There's the date.
Okay. All right. Okay. All right. Thanks, Mike. Thanks, Sam. I did have just a comment on item 6, and then I also had a question on item 10, so maybe call it.
Item 6, notice of intended public auction of tax defaulted property and resolution authorizing the sale at public auction of tax defaulted property.
Yeah, I just wanted to express a thanks, appreciation to several county staff members. With respect to one property that's listed here, I won't go into the detail, but difficult circumstances, not unlike a number of these where folks have fallen behind in their taxes and for a variety of reasons, but where the house is occupied by a party who had been caretaker, and the property is going up for tax sale. But I spoke even last afternoon and evening with both county staff and with the tenant, and I think they're well aware that the property is going to be offered for sale, and they may have to find other housing. We'll try to provide some assistance, but I want to thank county staff for their research. And we had conversations with Keith Floyd and with Ben Lamera and with Christina Wynn from the assessor's office, but I want to thank folks for their sound advice and counsel and help in this regard. So, yeah. That's all I had.
Item 10, approve the award of contracts for specified voting systems and authorize the county purchasing agent to complete negotiations and execute the contracts with each vendor for specified voting system solutions.
Yes, just very briefly, and I know I've talked with the county executive. I know Jill Levine's here. In my briefing yesterday, I had a question about whether, because it wasn't clear, and I guess it's still not certain as to whether we were actually leasing or purchasing, and I think that's still a matter of negotiations, but I guess I'm now curious as to if the registrars then authorized to make a decision, is it the county executive, does it come back to the board, or where are we with that? Because it's not really clear in the staff report about that. You made the selection and choices, recommendations for the various aspects of what will be the construct for the going forward, but it doesn't say about the hardware and software.
We are in the process of negotiating the contracts now, looking for the best, of course, and we're working with our Craig Rader from purchasing, and you have given him authority to negotiate these contracts. So that's where we're at this point.
So, Jill, that kind of raises the question then, are you looking to a combination of lease and purchase, depending, because you've got a number of different vendors here that are going to perform different tasks. Some of that comes with hardware, some comes with software, some comes with outreach tasks. And so I guess I'm curious, and with that mix and match, does that all line up with the life expectancy of maybe a piece of hardware that we were purchased, but or to lease the software, or vice versa? I guess, again, without getting too deep into details, we're making a major investment of well over $3 million, maybe more than that, maybe approaching $4 million, depending upon how we approach these. So,
and I can tell you, we've worked really close with Rami from DTEC with his technical knowledge of best to lease, best to buy, and his experience there. So that has been very helpful. So that's where we are in the negotiation. So it could be a combination of both, but we want to make sure that when we get done, we have the best for the county for the long run. So at the end of our lease or end of our purchase, that we still have the best for the county.
So when will we know that? I mean, obviously, the clock's always ticking in elections because there's always cycles. But I guess where are we as it relates to those decision points? And again, is it you that makes the decision? Is it the county executive, or does it have to come back to this board? Or today you get the authority to do that, and then you get the best price, the best set of circumstances, and
Supervisor Natoli, I think the resolution delegates it to the purchasing agent to finish the negotiations. That's where the authority we're seeking, with input from folks like Jill and our Chief Information Officer.
Okay.
Yep.
And that's going to be done, what, has to be done in the next few days, next few weeks?
We actually have a meeting this afternoon to continue working on one of the contracts, yes.
Okay.
So.
Okay. While you're there, Jill, very quickly on a related matter, and it's touched on briefly here with some of the activities, but I know that we had some discussion as we decided to go forward with the vote center approach, and and you've been doing a number of community forums and outreach to a whole host of community groups and other parties. But part of the question that I think was kind of left to be answered later was whether there was sufficient funding and resource support for not only for you, but any folks you would need to employ to do that. And as we now get close to that, kicking off the election cycle for the June primary and the general, obviously next November, I guess, and whether you can answer that today or not, but I would say before the end of the calendar year, which we have 2 more meetings after this, we want to have some broader discussion about the outreach and how that's going, but secondly, is there sufficient resources, whatever that entails, for you and others that are doing that, to make sure that, in addition to the hardware and software and having the best deal and having, the best approach for the voters of this county, are we going to be able to get the messages out that we need to, relative to something that's going to be very new to a lot of folks? So.
That's a tricky question.
Okay.
I can tell you that since June, we have made 64 presentations from our office to about, different local community groups, big groups, Rotary clubs, language clubs, that type of thing. So we have made a huge effort already. We've got several more planned for the future coming up, city council meetings in many of our cities here in the county. We are looking at our budget again. I've been talking with Britt. We've been looking at our past budget, our new budget, and there's things in our past budget that we will not be needing with the new system. And there are things that the chosen vendor will be assisting us with. Our biggest cost will be the postcards, as required in this bill, is that we have to mail out 2 direct point of contacts, direct contacts to all voters in the county. So that is what we're looking at right now, and like I say, we're working with Britt and our communication officer in order to kind of put everything in line and put definite prices on all of this.
Mr. President, Tony, I'm also going to be working with Jill and our clerk to have a report back to you on the status and all the outreach that's been done, and what kind of feedback are we getting.
Okay,
I'm looking at a December time frame.
Sure.
But I want to work with Jill to make sure she's done all her outreach, so it's either December or January. We'll be back to you on that.
Okay. Well, I think it'd be important. And again, I didn't want to. I knew you were working on it. I didn't want to, jump ahead too much. But I think, again, as time gets short, and obviously the task of putting in place, new voting systems and doing all the things that are required by law, but I think the outreach is the underlayment for a lot of that activity, and certainly which will be ongoing right up until probably Election Day in June, because the United States is going to be new to a whole lot of folks. It may not be foreign to them, but it will be new, and obviously how people can cast their ballots and how they're made aware of what those opportunities are is going to be very key to certainly turnout, but also people exercising their right to vote. So. Okay, so we'll be looking at maybe December before,
December, January.
Okay. All right, very good. Thanks, Jill. Thanks for being here. Okay, that's all the questions I had. All right, I had no one sign up on the consent calendar, so is anybody from the audience wish to address any item on the consent calendar? If not, if there's no other questions, then I'll entertain a motion on the consent calendar. Okay. Chair would second. Noting recusals on 18, 19, you got that, okay. Supervisor Peters, okay. Please vote.
Unanimous vote.
All righty, very good. Thanks. Okay, then we'll go to, we have a number of presentations, I believe.
We do.
Taking from the framed resolutions that are there at the dais.
Can you tell? Okay, so for items 30 and 31, I'll be calling them together. It's the presentation of resolution recognizing the Sacramento Kings Foundation, Good Tidings Foundation, and Kaiser Permanente. Also, it's the presentation of resolution recognizing Kaiser Permanente, Kaboom, and Southgate Recreation and Park District.
Okay, very good. And I believe Supervisor Cerna is going to do the honors here, so Bill, we'll let you take it from here.
Well, good morning, Mr. Chair and colleagues, and those in the audience this morning joining us in chambers. I don't know if you know, but once in a while I get a chance to go out and play some golf. And occasionally, I'm not that good. You don't want your elected officials to be that good at golf, quite frankly. But when I do go out, occasionally, a long drive will keep you coming back to play more of the game and hopefully hone your skills. This morning, we have, in my estimation, a long shot, a long drive. This is a great morning. We get to celebrate the culmination of a number of community partners that came together recently to do some great work in the South Oak Park, Fruit Ridge Pocket neighborhood, and the district that I have the good fortune of representing. This is the unincorporated area roughly between 14th Avenue, Fruit Ridge Road, MLK Boulevard, and Stockton Boulevard. Again, in the South Oak Park, Fruit Ridge Pocket part of the county. And I'm going to try and manage this as best I can with the assistance of my capable staff. We have a number of resolutions to acknowledge quite a bit of volunteered time, effort, materials to the construction of a new playground at the Jack Davis Park, which is really the only parklet that is managed by Southgate Recreation and Park Districts that serves this community, as well as the construction of a Purple Kings full court basketball court for the community. So what I'd like to do is just say a few words about both projects and who was involved, and then I believe we're going to see a brief video. And while that video rolls, I'm going to ask everyone in back of me that had something to do with both projects to come join me at the podium. So first of all, let me talk about the Kaboom Playground. I think many of us on the board and local elective office know in this community the great work that the Kaboom organization does. This is here's some imagery here on the left and right of chambers of the actual construction. But Kaboom is an organization that goes out and has these volunteer days, recruits sometimes hundreds of volunteers. And in this case, I think we actually had about 200 or 300 volunteers. You pick a Saturday, hopefully the weather cooperates, and it's a modern day barn raising of sorts. So we have people out, setting concrete, putting up the new playground equipment, setting the bark chips down on the surface of the playground. It's kind of a beehive energy out there at times. Having been out there for this, I was recruited right away to pour some concrete myself, and it really is an amazing effort to witness and be part of. This was, I think, the third playground construction project that I had the good fortune of participating in the district I represent, but certainly the first one that's serving the South Oak Park Ridge Pocket neighborhood. And so Kaboom and Kaiser Permanente were the principal contributing corporate sponsors for that part of that great day when we had a ribbon cutting to celebrate at the end of, again, a very busy day, the construction of the playground. And then next to that playground, you can see there we had the Jack Davis Park Court that was completed, and this was something that has been in the works for the last couple of years. I don't know if Scott Moak is here or not from the King's Foundation, but Scott is also a First Five Planning Commissioner, as you all know. He and I have been talking for several months about this project. At the park, previously we had a half-court basketball court, so the intent was to not only have a new surface, but to expand the surface and provide a full court basketball recreational opportunity for the community there. And as you can see by the slides, it turned out great. So at this point, what I'd like to do is, again, roll the video and then have everyone associated with both projects come up and join me, including all the contractors I see in back of me, and I'll recognize them by name after the video.
Okay, great.
The event today is Kaboom. That we're rebuilding the playground structure. Kaiser's a big partner. Supervisor Phil Cerna has been awesome in this area, not only with this project, but many others. So a lot of entities have come together to really just do and give back to this community that richly deserves it.
I gotta tell you, this is so rewarding to see an army of volunteers out here for a day's worth of work, participating in a modern barn raising, essentially, to get this playground built. So I first and foremost want to thank all the volunteers to spend your Saturday doing what's in the best interest of this great neighborhood.
It means community pride, first and foremost. It means the community and our elected leaders and organizations working together to build something beautiful that everyone can benefit from.
All right, terrific, thank you. So again, number of individuals, organizations were responsible for what you just saw there in the short video snippet. I do want to call them out, and please forgive me if I miss someone. Just tap me on the shoulder or club me over the head or something. But we have Josh Harrison with Harrison Concrete Cutting, Ward Winchell, Eric Jones, and Stephanie Vollmer with Southgate Recreational Park District. What are you guys doing up there? Get down there. Is Dr. Lisa Liu here? Yeah. Oh, very good. I saw you earlier. Okay. Michelle Adele, Director of Public Affairs with Kaiser Permanente. We have our own Chief Lee Seal, Chief of Probation. A few words about our probation department. They've really adopted this park, not just with regard to the construction of the playground and the basketball court, but over the last few years, having expressed a real driving intent to improve the quality of life out in that part of our county, Lee Seal and his probation officers, those that serve at our youth detention facility, have volunteered a great many hours out cleaning the park, helping us with broader neighborhood cleanups, and so I do want to certainly recognize all the great work by your department chief. Is Faye Wilson Kennedy with Black United Fund of Sacramento Valley here? I was told she might be here. Okay. You saw Michael Blair, the head of our South Oak Park Community Association in the video. I don't think he's here this morning, but I do want to publicly recognize him. We have Michael Smith with Tykert. And Tykert came through big time with provision of the materials. And let me tell you, some of you know that before I was in elective office, I had a small project management consulting business, and as I let everyone here know, in the few weeks leading up to the construction deadline, because we had to beat the weather, it really felt like the good old days, trying to manage schedules and budgets and personnel, and certainly I didn't do it alone. I had a lot of help, but it was actually good to kind of get back into the swing of project management for a bit there. Larry Gualco with Lennar. We have Nick Abdis with the Thomas Law Group. Nick was really kind of the lieutenant on this, helped find a great number of contractors, those that were supplying materials and doing the work, so hats off to Nick for his contribution. Perhaps the largest physical lift here was laying the court itself, the asphalt for the court, and I want to thank, where's Jason? Jason Pasquetti, with J.D. Pasquetti Engineering. He literally had the largest piece of equipment I know that park's ever seen placed on its property there. It's probably the same piece of equipment that's used for building roads. He had a laser grader out there as well, and was able to take the material supplied by Tykert and do the court in a few days. And I was out there every day. In fact, I took our chair, Don Natoli, out I think a couple times to see the progress, and it was pretty amazing to see what's involved with building a basketball court. There's a lot more to it than you'd believe. Adam Barrows with GR Trucking. Of course, we couldn't get started unless we demoed the old court and some of the associated walkway and retaining wall, and that had to be trucked away. And so GR Trucking certainly deserves a lot of credit for their help. Peter Rozakis, a good friend, is here, who's one of the owners of the firm. And so did I miss anyone? Nick, you're my lieutenant. No?
I think you got them all.
No, LNS.
LNS Concrete, they did the actual demo, right? LNS Concrete.
They laid the concrete.
Okay, they laid the concrete. There was a number of associated walkways and retaining walls after the court was completed that had to be constructed according to code and the architectural drawings that Southgate Recreational Park District committed to providing. So hats off to LNS as well. So with that, I want to say thank you. As I told everyone at the beginning of the project, we were going to do this once it was all completed. We had a great ribbon cutting. The most satisfying thing of all is, because I'm out in that neighborhood quite a bit, is actually seeing the community members using it and using more of it. I mean, they're out having basketball games. They're enjoying the new playground. We actually are adding some property, as some of you may know, to the park by way of an adjacent parcel that was tax defaulted, and we're continuing to work with our partners at Southgate Recreation and Park District to actually add property and more green space to that area. So again, hats off to this terrific team for all they did.
Mike Penrose.
And the chair just reminded me, our Director of Public Works, Mike Penrose, came through big time with some last-minute construction of some sidewalk and drainage that was very important to make sure that we didn't have any kind of trip hazards getting to and from the court. So thank you to Mike as well. So with that, everyone, as you can see, has a resolution acknowledging this great project and their contribution. But I'd like to invite anyone that would like to speak to come forward. I know Ward, as head of Southgate Recreation and Park District, wanted to share a few words.
And Phil, as Ward's coming up, I just want to say thank you to you for your leadership as well. I did have a chance to view a couple of different phases of the deconstruction and the construction, and it was pretty amazing. And to use your golf analogy, I don't think it was a long drive. I think it was a hole-in-one. You aced it on this one, so good job, all of you. So.
Yeah, I just wanted to thank all the participants on this project from the Southgate Recreation and Park District Board of Directors and the staff. There's a lot of big issues going on in the county, a lot of long-term projects, a lot of really difficult challenges socially and budgetarily. But really, everyone worked together on this, all the people behind me and lots of county staff. We got the project done basically in like 2 months from the design kickoff to completion. So it's just amazing to be a participant. I'm really proud to be a part of this community that can do something this important. It's just a small acre park, but it'll make a big difference in this community. So thank you.
Thanks, Ward.
Good morning, Michelle O'Dell with Kaiser Permanente. In the 4th year of our partnership with the Sacramento Kings, we were able to do a basketball court in high need areas. So we've done 3. This is our 4th one. So we had identified this as an area we wanted to do. And at the same time, we forged a national partnership with Kaboom, and we were also able to bring the Kaboom playground here. And this Jack Davis Park was the perfect location. It's been a labor of love, so I want to thank everyone here. I also want to thank Supervisor Cerna for championing this. It's a terrific opportunity for the neighborhood. We are so proud to be able to do these. We want to continue to do them. We're still looking for other sites around the community to build these courts. They make a huge difference for the families and the members who live in those neighborhoods. Thank you very much.
Thanks, Michelle. Thanks for guiding.
Okay, I'll just briefly say that, I reflect back on maybe 3 or 4 years ago. I took a truck with Supervisor Phil Cerna, truck drive, as many of you have throughout his district, and he showed me the areas that he's passionate about and his concerns, and we saw some things that were going on that were great, and also some parts of the community that really needed help, and they needed investment and they needed care. And this was one of those parks, and the neighboring area along Fruit Ridge, where there was the capacity to partner with the community and do some things really innovative as part of what we called then the Reducing African American Child Death Initiative, and we're going to talk a little bit about that later today. And what we see today, because of his leadership and what he's inspired us to do to partner with the community, it's had a really transformative effect, and I thank you for that. Our officers have really enjoyed being a part of that community, and the kinds of things that are happening there. There's still a lot more work to be done, but we're thrilled to be partnering with all these great leaders behind us and community providers. So thank you, Phil Cerna, for your leadership.
Thanks, Lee. any construction guys need to speak up. You guys did all the work, so.
Yeah, I was going to say one of the construction guys can come up here. I just wanted to say thanks again to Phil for his leadership on this. When I got the phone call that there was this need, I knew exactly who to turn to, and it was Peter and Adam from GR Trucking and Jason Pasquetti and Larry Gualco and the guys at L&S and Josh Harrison. I mean, they didn't even hesitate when they got the call. So it was an incredible coming together of a private-public partnership, and the real beneficiary is the community down there. So again, I think I speak for all these guys. It was really our pleasure to participate in this and having that grand opening and all those smiling faces, and from what I understand from Ward, families that are gathering, and that this is really becoming the center of neighborhood life out in this community. Again, it's really something special. So just glad to be a small part of that. So
thanks for your
thank
effort,
you.
Nick. Thanks, Nick.
All right, so now, as is customary, we're going to, I think, since we've got such a large group, move into the center area and take a photo here.
Larry and Jason in back, that's right, yeah. And Lee. Good. Thank you, Phil. Good job. Once again, thanks to all of you, and certainly to the broader community for responding, and thank you, Phil, for your presentation. Made Jack Davis proud, I'm sure. Okay. With that, then, a little behind the agenda, but we're going to continue this next item, so give folks a moment to exit. Okay. Go ahead. Hello?
Okay, item 32 is the cents per ton funding allocation program. I need a motion to drop this item.
We're going to drop it?
We're going to drop it, work with the CPAC, and then bring it back to you.
All right.
Move. So
Okay.
Second.
All right, move and second to drop item 32, and it'll return to us after it goes to the CPAC. Please vote.
Unanimous vote.
Good. Thanks to Leanne Surrender for responding so quickly this morning, so, no, thanks.
Thank you, Leanne.
Okay. Our next.
Okay, our next item, item 33, is the Sacramento County Child Death Review Team and Fetal Infant Mortality Review Team 2015 Annual Report.
Okay. Our presenters who are veterans at doing this, so good morning and welcome, and appreciate your work on this, and turn it over to you, Sheila.
Good morning. We're delighted to be here. I'm Sheila Boxley, the President and CEO of the Child Abuse Prevention Center, and for the last 26 years, we've been the home of the Child Death Review Team. And I think, yes, we do have a slide up. Okay. We are very honored to be here to present this report, and I want to start out by mentioning that the format is a little different in one very important way, and that is this is the first time that we've combined into one report the Child Death Review Team and the Fetal Infant Mortality Review Team. And we think that that's a very positive change because it's really going to give a broader picture and more information in one location that's really interrelated. So we think that's going to be very helpful. I will remind you that the mission remains the same. The reason for the team is that we're looking at ways to prevent children from dying. And even though the penal code section that authorizes child death review teams really focuses on child abuse fatalities, we are very fortunate that for the last 26 years, this team has looked at every death of every child 0 through 17 in this county, regardless of the cause or the manner of death. So it's a very comprehensive document, and we especially want to thank the Children's Coalition for the continued funding through the Children's Trust Fund, because a report like this is not something you can just kind of do with volunteers and make happen. It's a very sophisticated process. I also want to thank the 24 different organizations and the individuals who represent them who are part of the team. Because the way this works is that it requires that we have all the relevant disciplines represented on the team and sharing their information. So thanks very much to them as well. And you will also see, those of you who are veterans and have seen many of these reports, that this one has more pictures and less words and is a bit more colorful, and so we hope that it'll be a little easier and more user-friendly for people. Very importantly, though, we have also organized it a bit differently so that you will see there are 3 areas or types of deaths for which we have more intense thematic reviews, and that includes infant sleep-related deaths, child maltreatment, and fetal infant mortality. So hopefully that will also be helpful to you and others in terms of using the data. It is my pleasure to introduce to you Dr. Michelle Evans. She is the Vice Chair of the Child Death Review Team. She is a pediatrician with Kaiser, and she also serves as the Medical Director of the Northern California Child Abuse Services and Prevention Program. And I should tell you, in addition to being a great partner on CDRT, she has also been a great partner with us in the Safe Sleep Baby program and also in the Planning for Child Abuse Prevention Month. And so with that, I will turn it over to Dr. Evans.
Good morning, Dr. Evans. Thank you for being here with us this morning.
Good morning. Thank you. It has been my pleasure to serve on the Sacramento County Child Death Review Team, and I'm going to share the findings. So, okay. So there were 126 children who died in Sacramento County in 2015. 124 of them were Sacramento County child residents, and of the 2 out-of-county children who died, these were injury-related deaths. In 2015, the child death rate decreased from 37.4 per 100,000 children. The out-of-county children are not included in this death rate. This is a decrease from the 2013-2014 death rate of 36.4 children per 100,000. If we look at 2014 alone, the death rate was 37 per 100,000 children. This chart shows the number of 2015 child deaths among Sacramento County residents only. So in 2015, the death rate decreased by 2.3 from 2014. And out of the 124 Sacramento County resident child deaths, 20% had an injury-related manner, 71% died of natural causes, and 5% were undetermined. So this shows the kernel density distribution of the place of residence of all Sacramento County resident children who died in 2015. The darker regions indicate a higher concentration of child deaths, and you can see toward the center, the largest concentration of deaths was in the Valley High area, and the Valley High concentration may be related to a high child population density. This looks at the number of child deaths by manner and race for 2015. So of the 124 Sacramento County resident child deaths, 28% were white versus 35% of the population. 24% were African American versus 10% of the African American child population. 21% were Hispanic versus 31% of the child population. 15% multiracial versus 9% of the child population, and 12% were Asian Pacific Islander versus 15% of the child population. So in 2015, there were a total of 9 child homicides. 3 of these were determined to be child abuse and neglect homicides. This is compared with 5 in 2014. 6 of them were third-party homicides, and of these third-party homicides, 2/3 of the perpetrators were involved in gang activity, and half of the deaths were associated with gangs. Now this looks at the number of child deaths from the 11-year period from 2016 to 2015, and these are 3-year rolling averages so that we can smooth out the yearly fluctuations. The overall deaths decreased from an average of 174 per year in the 2004 to 2006 period to 130 per year in the 2013 to 2015 period. The number of infant deaths decreased the most from an average of 105 to 79 during the same period. And the number of deaths decreased in all ages except for the 10 to 14-year-olds. 61% of the resident child deaths were infants under the age of 1 year old. So this is another way to look at the child death trends. This is a rolling 3-year average child death rate from 2006 to 2015 for Sacramento County. The child death rate has decreased over this time period. We have a statistically significant decrease in injury-related deaths between 2006 to 2010, and in the 2011 to 2015 period from 10.1 to 8.2 deaths per 100,000 children. This is statistically significant at 97% confidence level. The death rate also decreased for natural deaths during the 2004 to 2015 period. So this looks at deaths classified by manner. So the deaths are classified as natural, injury-related, or undetermined. The undetermined category is comprised of cases that the coroner has determined insufficient evidence to identify the exact cause of death. An example of an undetermined death is an infant sleep-related death with not enough evidence to determine the cause or the manner and risk factors that preclude the determination of a SIDS death. So this shows a breakdown of Sacramento County child resident deaths by category for each year from between 2006 and 2015. The deaths due to perinatal conditions decreased from 3.03 to 1.86 per live birth between 2006 and 2015. This drives the overall infant mortality rate in Sacramento County from 5.12 to 4.06 per 1,000 live births over the same period. So next we're going to do a thematic review. So CDRT identified risk factors for all child deaths, deaths related to child abuse and neglect, infant sleep-related deaths, and fetal infant mortality. So this looks at a 12-year review of child abuse and neglect homicides. There were 69 total. We again have a disproportionate number of African American children. 81% of the children were 5 years and younger. 70% of the perpetrators are parents. So there were a total of 84 perpetrators of 69 child abuse and neglect homicides from 2004 to 2015. Male perpetrators are the most common in beating and abusive head trauma. And nearly all child homicide victims had a known risk factor. CPS was the most common risk factor at 80%. CPS involvement is unknown for 10 of the child abuse and neglect homicides. So this looks at the number of child maltreatment deaths and the percent of child abuse and neglect homicide deaths. So we have an umbrella classification of child maltreatment. These are deaths that involve some element of abuse or neglect. An example is a perinatal death that involves substance abuse or a drowning death that involves neglect. Child abuse and neglect homicide is a primary category of child maltreatment deaths. In 2015, 10 children were involved in child maltreatment deaths. And these deaths from 2006 to 2015 among Sacramento County residents decreased from 4.85 deaths per 100,000 children in 2016 to 2.77 deaths per 100,000 children in 2015. So this looks at the rate of child abuse and neglect homicides among Sacramento County residents between 2006 and 2015. It's a 3-year rolling average that has fluctuated during this period. There's a high of 2.0 per 100,000 children in 2008 and a low of 1.0 per 100,000 children in 2011. The 3-year period between 2013 and 2015, there were 1.4 child abuse and neglect homicides per 100,000 children. So this looks at the African American disproportionality for 2015. The African American child death rate was 81.7 per 100,000 children. This is compared to the overall Sacramento County child death rate of 34.7 per 100,000 children. These rates are similar to the 2013-2014 period. We did, however, see a 29% decrease in African American sleep-related deaths in the 2013 to 2015 period. So in 2013, 50% of infant sleep-related deaths were African American infants. In 2014, 36% were African American infants. And in 2015, 21% of infant sleep-related deaths were African American infants. So this looks at 5-year trends of African American child deaths by cause. These are the percentages of African American children deaths compared to the African American child population in Sacramento County of 10%. In 2011 to 2015, all child deaths among African Americans were from causes similar to prior years. So African American child deaths were greatest in child abuse and neglect homicides, infant sleep-related deaths, perinatal conditions, and third-party homicides. So this is a closer look at infant sleep-related deaths. So for the 2015 data, 100% of the infants were found in sleeping conditions that were known by the American Academy of Pediatrics to be unsafe. And 36% of these infants reside in neighborhoods that were not targeted by the Safe Sleep Baby campaign. We found a statistically significant correlation between a history of CPS referral and infant sleep-related death at a 99% confidence level. So an infant with a history of CPS referrals is 2.3 times more likely to suffer an infant sleep-related death than an infant who has not had a CPS referral. So I just want to clarify, this is referral, so CPS may or may not have had contact with the family depending on if the situation met their criteria or not. We also saw a statistically significant correlation between a history of CPS referrals and infant sleep-related deaths in neighborhoods with very high economic risk at a 98% confidence level. There was no statistical significance between CPS history and infant sleep-related deaths when we control for race. So this is a closer look at the unsafe sleep conditions. 100% of the 2015 infant sleep-related deaths were infants in unsafe sleep conditions. 93% of the infants were not in a crib. And of those, 45% were known to have a crib in the home and were not using it at the time of death. This data is from known information only in the 124 to 215 child deaths. 83% had at least one risk factor. 45% had 3 or more risk factors. 60% of the families received some form of government aid. 50% had a history with Sacramento County CPS. 20% of the parents had a substantiated CPS referral as a child. 30% had a known history of illegal drug or alcohol use in the child's family. And 43% of the child deaths had a criminal history in the family. So this is another look at the risk factors. 55% of all 126 child deaths had a past or present family involvement with a CPS agency. And half of the deaths had families that were involved with CPS within 6 months of their death. So these are 2006 to 2015 3-year rolling averages of the percentage of deaths with specific risk factors over this period. And what we can see most dramatically is that poverty has risen over this period from 37% to 63% of decedents.
Excuse me, Dr. Evans, so 63% of all those where the deaths occurred, you did this rolling average, so the poverty level rose dramatically. Which subset, though, this is all families, or this is of the
This
ones?
is all of the child deaths.
All child deaths?
Yes.
Okay.
So now I'm going to turn the presentation back over to Sheila to review the recommendations.
Can I ask one question?
Sure. Yes.
And I don't know if you have it at your fingertips or not, but since you have this graph up still, the AOD, alcohol or other drug percentage, they're at 39% in 15. Do you know what it was at the other end of that bar in 06? So do you know what the percentage was in 06?
We can find out.
Okay. All right. Thank you.
George, Kennedy, you got a question? Okay. Could I just ask one other question? We have this chart up, though. So, with the exception of domestic violence, was a fairly flat line. We're seeing a rise in all of these risk factors. Is there any other determinants behind all of that? You see a rise in violence. You see a rise in the drug and alcohol involvement. Obviously, CPS is more involved, but you're still having a number of deaths. And in poverty, and again, I don't know what the definition behind that is, but obviously it's folks who are on some level of government assistance or on subsistence. So any other thoughts about that one can extrapolate? We're seeing, over the course of a fairly short amount of time, all the risk factors, with the exception of one, as you listed them here anyway, well, I guess maybe two, the medical piece is not a dramatic rise, but I guess I'm just...
Yeah, these are things that we're going to that Sheila's going to discuss more in detail in the recommendations.
Okay, all right, thanks. Thanks, Dr. Evans.
Thank you. I'm very glad that you had a chance to reflect on and look at this chart, because it really is the basis for some of the recommendations and thoughts that the team has had with regard to so what do we do with this? Because again, remember, our mission is to use the data to find ways to not only save children's lives, but also save those from injury. Because a lot of the kids, in fact, don't die, and we're very grateful for that, but they may have been injured or suffered severe trauma or other kinds of things that impact the rest of their lives. So there are 6 recommendations that the team is offering today. And the first one is that the Child Death Review team wants to bring together a subcommittee that is augmented by individuals in addition to those who are on the Child Death Review team to look at the last 12 years of child abuse and neglect fatalities. And part of the reason that we want to do that is related to that chart and what has been happening and changing. But importantly, it is a best practice now to do that kind of work. And the Federal Commission to Eliminate Child Abuse and Neglect Fatalities, in their report to the President and Congress, basically called out this practice and said that this would really be something that jurisdictions should undertake. And for example, Baltimore has already done it. And we have tried with the Child Death Review team to really keep up and always be on top of those best practices and ways of doing better and finding more ways to save kids' lives. I want to be really...
Supervisor Stern had a question. I didn't mean...
I'm sorry.
I had a question there, Sheila. And I hope I'm not going to get ahead of you here, but hopefully if it's the intent and we ultimately follow through with setting up a very focused committee structure to focus on CAN homicides, how is that going to intersect with, which is probably going to be one of the most challenging parts of the Black Child Legacy campaign effort, to focus on the disproportionality in the African American childhood population when it comes to CAN homicides? I reflect back on the 41% that I saw earlier. So how are you going to work in conjunction? Maybe you've already given some thought to the architecture of working groups.
Yes, and you'll find in the more in-depth recommendation that's in the report itself that we've listed, at least at a minimum, the organizations or disciplines that would be invited to participate. And so that includes the current members of the Child Death Review Team, policy leaders, county agency directors from Department of Health and Human Services, Public Health, Behavioral Health, District Attorney, Probation, Law Enforcement, Coroner, City of Sacramento, and other cities, hospital systems, child abuse and neglect physicians, nonprofit agency stakeholders, domestic violence, home visitation programs, First Five, the Steering Committee on Reduction of African American Child Deaths, Black Child Legacy, and the Child Protective Systems Oversight Committee. So that's kind of a beginning of who would be involved. We're really seeing it as a subcommittee. This is not a brand new commission or something like that. It is to be very time limited and to come back with specific findings and recommendations. So absolutely it will address all of those risk factors. It will address disproportionality. Hopefully the committee will have that chance to go in depth. And part of the reason for wanting to do this now, other than the fact that the penal code tells us to do this sort of thing, is that with 12 years of data, we have 69 cases. And so that gives us enough scope, enough cases to really look at in terms of historical changes as well as what we could be doing. And I want to point out that I think that you know that children in their first year are the most vulnerable of child abuse fatalities. And what the research is telling us now is that for every infant child abuse death, there are more than 10 children who were seriously injured, life-threatening injuries. So we're not really talking about just looking for ways to prevent those deaths. We're really looking at not 69, but 690 kids, that volume of what we could really do to make a difference.
Injured that are reported or are not reported?
All we know about is what has been reported, not reported to CPS, reported maybe by a hospital because somebody comes in. And I think it is important to note that of those 69, only about 50% of those cases were current open CPS cases. So we're really looking at what can we all do and where can we find those intersections in those places to make a difference. So that is our first recommendation, and we really do believe there will be a significant value to that, and we would like to be back to you in 15 to 20 months with that and really start to take action. And we're not necessarily looking for, oh, gee, how can we find a whole bunch of money? We're looking at what can we do when we know more about these cases. The second recommendation is to expand shaken baby prevention education to include the dangers of abusive head trauma and beating, and to expand the engagement of male caregivers. We know that that is something important that we need to do. There were 48 child abuse and neglect homicides that were from 2004 to 2015 that involved beating and abusive head trauma, and so it certainly is a significant part of that population. 74% of the perpetrators were men. There is currently, we have a great partnership with CPS and the hospital systems to be providing education at this point about shaking babies. We want to expand that and really work with the Birth and Beyond sites, community incubator leads, First Five, CPS, Head Start, and schools to see if we can penetrate a little more, particularly reaching the male caregivers. The third recommendation is to develop a county-wide protocol for public and private agencies to refer families to support services when they identify in the family recognized risk factors for child death. And that, going back to the chart that you were asking about, is very, very important. What we see is that these families, when you look at that chart, what we're looking at, let me just say, is known risk factors. So that means they came to the attention of some one of those 24 agency members of the Child Death Review Team. So whether they got public assistance and that's how they were identified, or whether their risk factor was a prior CPS case or a domestic violence call that was reported, these are probably underreports. because not everybody comes to the attention of all of these agencies. But what we do know is that somewhere along the way, these families in large numbers, large percentages, are being touched, are being served by some public or private agency. And if we can begin to look at how we work better collectively so that when someone comes in and they need A, we don't only look at A, we look at what else is happening with that individual or that family, and perhaps make effective, warm handoff referrals so that people can get the services that they need, and ultimately try to reduce those risk factors, which obviously are very much a part of child deaths. And again, that is not just child abuse and neglect fatalities. We're really talking about looking at all types of deaths, because that's what the chart was showing you that Dr. Evans addressed previously. Okay. It's not moving. Okay. The next recommendation is to collect more data on third-party homicides so that we can effectively target intervention efforts, especially for deaths involving firearms and gang activities, as those are a very large part of that risk. And we do have a subcommittee of the Child Death Review team. It is the Youth Death Review Subcommittee, and they go deeper into these cases. And what we're looking at is that we don't have all the information that we really need, and need to go deeper into this area, because it is an area that is not necessarily declining in the same ways. And so that committee has really charged itself, if you will, with let's get deeper, let's bring in more partners and look more closely at those deaths to see if we can start to come up with some effective strategies. Oops.
Sheila, can I?
Sure.
On the first bullet there about deaths involving firearms and gang activity, one of the things that you're probably aware of is that the county and the city of Sacramento have recently invested in the ShotSpotter technology. Mm-hmm. So I suspect that's going to give us all kinds of new data sets about different things. Yes. But if some thought hasn't already been given to maybe how best to access that new tool, and not just relative to firearm deaths, but firearm activity, even employing some maybe GIS technology to understand the geographic nature of firearm activity, shots that are spotted, and see how that might help inform more or less at the neighborhood level where we can begin to really focus geographically on the problem of third-party homicide, firearm-related third-party homicide.
Thank you. Yes, I know the team is aware of that, and that will certainly be a part of the analysis. And it will be, we hope, a helpful benefit in addition. The fifth of our recommendations are to expand training and education efforts to parents and caregivers of infants with Child Protective Services referrals to reduce the prevalence of infant sleep-related deaths. The good news is that the numbers are better in some categories now for sleep-related deaths. We have an existing very good partnership with CPS in terms of that education. And you may know that at this point through all the partnerships that we do have cribs available, and First Five has been a very important partner in that. And when we give away cribs, because it's so important, and Dr. Evans highlighted that often people have a crib, they're just not using it, and the child still dies of a sleep-related death. So at this point, what we're doing is when we give away a crib, we also have I guess a little hook, if you will, because we deliver it and someone spends an hour with the family talking about why it's important and all the other kinds of protective factors for reducing infant sleep-related deaths. We feel like that we need to reach out more. I mean, as an example, what you saw in the information that Dr. Evans provided, we're doing a pretty good job in the areas there we're under contract to work with. But now what we're seeing is that there's increases in sleep-related deaths, or that a bigger percentage of them are in other neighborhoods. So it is a moving target. And certainly, I know we've talked about it before, but with sleep-related education, it's really something that has to be done continuously because there are new moms and dads all the time, and the fact that you told somebody else last year doesn't necessarily help. So it is an ongoing effort. And the final recommendation is to continue the effort to reduce the death rate of African American children. Obviously, there are other folks who are going to be here today who are going to talk about that and what the progress is and what the needs are, but the data continues to be clear and compelling that this has to be an ongoing priority at all levels. I will say that the good news that we can report to you in that regard right now is the reduction, the decrease that has occurred in African American infant sleep-related deaths. And, this is pretty preliminary because the effort has not been underway for a long time, so we're going to continue to monitor that, but there is a ray of sunshine there, if you will. So now I'm going to ask Dr. Kassiri to come up and present to you the part of the report that deals with fetal infant mortality. And then we'll all be here, so at the end of her presentation, if there are any other questions about the full report, we're happy to answer them.
Thank you, Sheila. Good morning, Dr. Kassiri. Good morning.
Good morning, Mr. Chair and members of the board. As Sheila mentioned, this is a new addition to the CDRT report because the fetal infant mortality review was being done internally in public health, and we were very glad that we were able to develop a partnership with CAPC to add this review to the CDRT report because we think that there's a lot of good information that could be shared, and having the two together would definitely be a good thing in providing information that we need to be able to move forward. The importance of the fetal infant mortality rates is that these rates are a bellwether indicator of the community's health, as many of the factors that affect the health of the entire population also affect these rates. So one of the things to note is that by California law, all fetal deaths have to that have advanced to or beyond the 20th week of gestation must be registered and receive a fetal death certificate. So the way that we selected the cases for this review included all deaths of infants born prior to the 23rd week of gestation, all fetal deaths that had received a death certificate, and in addition, we also looked at all fetal deaths to babies that were African American. Parents had African American parents, plus 25% of the remaining cases. So we had a total of 99 cases that met the criteria, and we were able to review 52 of them. The rationale for reviewing all of the African American cases, as you have seen with the CDRT data, and you see also with the FEMA data, is there is a disparity, and that we needed to look at that to see what the factors were that we could address. So this is some of the information, and as you can see, close to about a third of the FEMA deaths reviewed were associated with pregnancy-related infections. This includes sexually transmitted diseases as well as others. And so as we look at prevention, this is an area that we need to look at, especially in terms of making sure that mothers start getting prenatal care early enough so that these infections are identified and treated. You'll also notice that umbilical cord accidents and premature rupture of membranes was also a major issues that resulted in FEMA deaths. And these are things that also resulted in preterm births. Fetal exposure to alcohol and other drugs highlights the need for increased substance use support for women of childbearing age. including medication-assisted treatment, and also reducing the barriers to entering early prenatal care for substance-dependent mothers. As we have found, oftentimes mothers who are using substances will be hesitant to start prenatal care because of the fear that their children might be taken away or that they might be reported to CPS. So being able to work with them and make sure that they understand the importance of the prenatal care and being able to get treatment early enough is important. Another important thing is the health of the mother. As you can see at the bottom of the slide, 59% of the mothers were overweight or obese with a BMI of 25 or greater. The other thing that's not shown on here is diabetes and hypertension. These were also chronic diseases that were related to adverse child birth outcomes. We also noticed that prior fetal loss and prior preterm delivery were also important factors that did indicate problems for ongoing pregnancies. So it's important that when we do have parents who experience these losses, that there is ongoing care or interconception care, so that when they do get pregnant again, that they do not have the same adverse outcome. Looking at race, as we mentioned, there are disparities. For African Americans, constituted 21% of the deaths, although they constitute only 10% of births. For Caucasians, 26% of deaths, whereas they constitute 39% of the births. For Hispanics, it's 13% of deaths compared to 27% of births. An interesting thing to note also is for the multiracial, where the disparity is even higher, even though the numbers are low, but you have 26% of the deaths compared to only 6% of the births. So these are things for us to note and to look for factors that result in these disparities. For family risk factors, I do want to point out that when we were looking at these, it's not so much that they are risk factors for adverse birth outcomes, but they were more as a proxy for other factors, social determinants of health. For example, when you look at families receiving government aid, 52%, that indicates that these are people who are either in poverty or had other resource needs that were not being met, and therefore led to them having to seek additional government aid. I'm going to skip over this one because it's information that I've already given. Over 1/3 of the cases had at least one major life stressor. This is an issue that has been looked at over and over again, especially with maternal and child health programs, the importance of stress, not only for the pregnant mom, but also even for women of childbearing age, because now we know that stress affects not only the health of the mother, but also does end up affecting the health of the baby as well. Some of the major life stressors include things like lack of support, family support, frequent moves, homelessness, job loss or unemployment, major illness, and substandard housing. And these are all factors that lead to stress. One of the other things we found is, compared to all new mothers in Sacramento County, mothers that experienced fetal infant mortality death were more likely to be under the age of 21 or over the age of 35. So we do know that these two age groups are at higher risk of having adverse birth outcomes.
Dr. Kasseri, you moved that slide, but the next bullet there where you said more likely to be employed.
Yeah.
So how does that factor into the risk? Because they're working right up until delivery, or what?
It's not a risk. I think it's one of those things that was noted, but when you do look at the statistical significance, there is no statistical significance. That's the same thing with the being born abroad.
Born abroad, yeah. I just was curious because it struck me as being a bit curious.
Yeah,
Okay.
it's not statistically
Okay,
significant.
thanks. Okay, thank you.
So looking at the distribution of the deaths, you'll find that this is actually very similar to what we saw for the CDRT. And when you look at the insert, the distribution is very similar to where you find higher child populations. So it does help us in knowing where to focus our resources, and especially with the next presentations that you're going to have, looking at the neighborhoods with the highest concentration of the deaths, which include Arden Arcade, Valley High, and North Highlands. So this does indicate that I think we are focusing our resources in the right places.
Can I interrupt for a second?
Sure.
I have kind of a dumb question, but when the death, the geographic location of the death
Yes.
Is recorded, how is it recorded? Is it recorded at the registered address of the family, the parent, or if the child dies at a hospital, where is it recorded?
This is the address of
In all
the
cases?
parent. In all cases,
Okay,
yes.
thanks.
So moving to the recommendations, some of the recommendations, and as I mentioned, this is a new addition to the CDRT, so as time goes on, we're going to definitely have more recommendations, especially when we get to our next report. But some of the recommendations that came up was identifying real and perceived barriers to early entry into prenatal care and being able to address those barriers, especially for women with substance use disorders and for those experiencing domestic violence. Again, stories we have heard over and over again is that in many of these cases, especially for the younger mothers, there's a fear of accessing prenatal care because there's the impression that they will be reported or that their child will be taken away. And so being able to provide the education so that they know that when they do present themselves, that they will get the help that they need is really important. Also, preventing and diagnosing and treating infections, especially sexually transmitted diseases, and also chronic health issues. And especially with chronic health issues, it's important to not only address them during the time of the pregnancy, but also to look at preconception and interconception care. So looking at all women of childbearing age and encouraging them to be healthy, I think is really important. Also addressing the behavioral, social, and economic disparities of mothers that manifest in low birth weight and preterm babies. I believe that's the last slide. So.
Okay, Dr. Kasseri, thank you. And now it's time for any board member questions or comments. Our three speakers, or any final comments, Sheila? Or are you just seeking out questions? Okay. Okay. All right. Any other comments from my board members? If not,
Okay,
thank you to Dr. Evans, Dr. Kasseri, to Sheila, to all the folks on the review team. Obviously, there's some recommendations. I think before we leave this, though, so we have the 6 recommendations. Next step, we're going to response to those recommendations about implementing some of those things. Some of those will require a commitment, either resources and or some commitment to
Yeah, with all these reports, with the recommendations, we're going to look at what kind of commitments needed, time, and with budgetary adjustments as we go forward.
Okay, so when would we take those all as a group then, Nav? You'd come back with, again, the 6 recommendations, some additional recommendations, obviously, for Dr. Kasseri. How would we know at what point in time either we implement, either go through budget, or you're going to bring a package back to us that will provide some staff response and some...
With the budgetary stuff, of course, will come to the budget. There will be a package that will identify them. If it's not in the budgetary, it will be a different report that we'll give to you on implementation.
Okay. Supervisor Stern?
Thank you. Actually, did have a question for Sheila.
Okay.
Yes. So first of all, thank to you and to the entire team for all the great work that goes into the report. I can tell that it's become more refined in just the short amount of time that I've been on this board since the first report that I saw back in 2011. My question is this: what is being done, if anything, to educate our state legislative representatives about this? I know there's a great amount of interest shared by Assemblymember McCarty and Senator Pan on the subject of just understanding the nature of child deaths in the county. There's been some discussion in the last couple of sessions, especially by Assemblymember McCarty, about possibly carrying legislation that would look at requiring all counties, all 58 counties in the state of California, to do something similar to what we do here in Sacramento County to best understand the nature of those deaths. So is there a plan to give a similar presentation to each of them or to our contingent of legislative representatives for the region? And if not, is there some way we might be able to facilitate that?
Well, we would love any help we can get in terms of that kind of outreach. In terms of our local representatives, they are all aware of this report, and we certainly send them that information, and we have provided technical assistance to Assemblymember McCarty's office with regard to the legislation he proposed. Unfortunately, state funding that used to exist that would allow for some collaborative work regionally among child death review teams was eliminated during the recession and has not come back. And so while we have the most robust report, some counties either are very small and really it wouldn't warrant a full report like this. If there's, in fact, if there's one death, that's going to be really clear that everything said is about that party. But there really isn't necessarily the same commitment. We are blessed that all of the county departments who have relevant information are fully participating in this. That doesn't always happen. And I think, but we do distribute the report. I hesitate to say this, but I'll say it. I think sometimes other members of the legislature who are from other geographic areas maybe don't see the relevance, but as it turns out, this is the most comprehensive report we have in the state, and so it does have relevance beyond just Sacramento County. So yes, we'd appreciate any and all kind of support because we'd like to see more of this data statewide. I should also say that there is in statute a state child death council, and in the statute that authorizes that, we as an organization, our corporation that Prevent Child Abuse California is actually listed and is a member, and we were participating members, but also during the recession, that money went away, and just as we couldn't do this without staff, I mean, it requires technical expertise and so on. As soon as the funding went away for those positions, it's still in statute, but it's non-functioning.
In terms of the report itself, is it possible for each of our offices, if we were interested in getting an overprint or 20, 30 copies that we might be able to take with us and maybe have available to members of the public at the various community centers that are in our districts?
We'd be happy to do that.
Great, thank you.
Yeah. Thanks once again, Sheila, and to Drs. Evans and Kasiri, and to all of our team members, and again for some very sobering information, but also shows, I think, some of the work that's being done, and very importantly, some of the lives that are being saved. Obviously, much more work to do. So, okay, with that, we have a receive and file, and I understand there'll be some follow-up by county staff relative to some of the recommendations that are here, and some of those will come before the Board of Supervisors. So I had no one signed to speak on 33. I've got a whole bunch on 34. So is there anybody on this item wish to address the board? All right. If not, then just as we call that, we'll note that on item 34, I have almost 40 speakers signed up in addition to this presentation. So when we get to the public comment portion of the program, I'm just at 2 minutes. So if you have comments, be thinking about trying to do this within a 2-minute time frame. So with that, then Flo, go ahead and call the item, please.
Okay, item 34 is the fiscal year 2016-17 annual report on the reduction of African American child deaths.
Okay. And who's our presenter? Dr. Heller. We know you're in the house. I think you've been coming about.
Sorry. I usually jump up more quickly.
All right.
Good morning. Since there's 40 speakers, I'm going to go quickly and get to them. I think you are all very familiar with the timeline and the history of this terrific project. And we've had some discussion already this morning of the baseline data. I think what's interesting about the data in this summary is that essentially we see about half of the African American children died for reasons that I would say are related to public health, and half due to, and maybe 14% or so due to violence. I don't know that the public and the media always portray that accurately. The half of the deaths are health-related, public health, preventable deaths, and a smaller percentage due to violence. Worth pointing out. I think we already reviewed the CDRT findings, so I won't spend any time on that. I'll get right into the program. We're very proud of this work. We know that in 2015-16, the fiscal year, was when we first entered into the contract with the Sierra Health Foundation Center for Health Program Management. It's been an excellent partnership. You're going to hear some description of work that's going on under that contract, so I won't take the time to do it myself. Probably the most significant, most visible impact to date is the creation and development of the community incubator leads in the target neighborhoods. And I just want to call out in particular the members of our staff at DHHS who are part of the multidisciplinary team outstationed in each of the focus neighborhoods. That work is I just want to characterize it for you rather than just report that it's happened. It's kind of spectacular. It's kind of transformative. I think as managers, we watched it happen and wondered if people would feel put upon, or there would be some skepticism, or people feel like they're being forced to be outstationed. Not at all. It's culturally transformative within our department, both in public health and with CPS. People are very invested in this work. Partnership is not just a word we use lightly, but it is changing the way people do their work. The credibility and trust that's being developed as a result of these outstation personnel has impressed me, and I just wanted to characterize that and make sure you knew it.
Fair to say that some of your staff have been hungry for work like this or a project like this?
Yes, I think so, and it's hungry for it and optimistic about the impact, and feeling like they're instead of feeling like people are suspicious of their role in the neighborhoods and families they're trying to help. There's more credibility and acceptance and belief that they're trying to help. There's more what I would say is there's more reaching out for an understanding, in particular, of how Child Protective Services works, instead of an avoidance based on mythology. I think that's going to have a tremendous impact on achieving the objective of actually reducing children getting hurt and dying. I'll also call attention to the establishment of the African American Perinatal Health Program. This is a public health program focused on the pregnancy, childbirth, infancy period. I always like to say that because perinatal is such a difficult word. Not only are we dealing with issues of nutrition and drug use during pregnancy, but issues you might not realize are part of the program, such as intimate partner violence, infant development, and so forth. I hit the wrong button there. Let's try again. A little more on that program is mentioned here. You see some outcomes being achieved among the participants, with very low numbers of premature births and low birth weight, great numbers on sleep-related deaths and breastfeeding among the participants in the program. Obviously, the role of the community incubator leads and the partnership with the community agencies to make sure that these results are achieved, not just among participants who get our home visiting services and participate in this program, but more largely throughout the community. Multidisciplinary teams is a CPS effort. And I talked a little bit about the effect of these. This has to do with various professionals and paraprofessionals and community trusted workers. When there has been a CPS referral, dealing with the family and making sure that the action plan for that family is appropriate. We've already talked about the outstation sites. I want to mention there's an abbreviation here that's sort of important that you understand. CPS staffed all 7 outstation sites with what we call informal supervision social workers. These are social workers who are focused on families at risk with the intent of keeping those families intact, making sure the families get the referrals and support services they need so that children do not need to go into foster care. And we've talked a little bit about what some of those might be, but this is where you would find successful programs like the Early Intervention Family Drug Court, where we get addiction-related services to families and keep families together. So we've talked about this whole effort as a way of reducing injuries to children and reducing child deaths in the African-American community. But I just want to add my commentary that part of the objective and part of the reason that the trust is being built is because another objective is to keep families intact in the African-American community. Yep, I keep hitting that button. There we go. This year we have begun the Cultural Broker Program. This is a program aimed at making sure that there are trusted people in the community who can advocate for families when they do get involved with CPS. We did a competitive procurement and awarded contracts to 3 organizations, A Better Life Children's Services, Sacramento Children's Home, and the Sierra Health Foundation. The certification training for cultural brokers is going on right now this month, and we begin services probably in January so that there are trusted advocates, trained advocates to help families through the CPS process. I'm going to turn these remarks over to my colleague Lee Seal to talk about the probation department's involvement in this project.
Okay, thank you, Sherry.
Good morning again, Lee.
Good morning, Lee Seal, Chief Probation Officer. It's a pleasure to be here talking about this important effort. I'll follow the cue of my counterpart and keep my comments brief as well, move quickly through the PowerPoint. In fact, maybe ignore our PowerPoint altogether, because really what is important aren't the stats, it's not the numbers, it's the people behind me, the little baby back there who I'm glad is here to remind me and all of us why we're doing this important work.
A very happy baby.
Yes. You know, this work is personal for all of us. It's, you know, all of us. I have kids in the community. My manager has kids in the community. The team members up here, all of us are in this together, and we all want to make this work. The board invested in our department. We have 5 probation officers that were newly created as part of this. This is extremely important for us so that we have the resources to engage in the community. But what's important isn't just that we add 5 probation officers. If I talk to my friends in the community and say we're going to put more badges and guns in your neighborhood, the reaction is going to be mixed. The reaction is going to be, well, okay, you know, we appreciate the enforcement activity and we understand that that's a component of what's important, but what's more important and what this initiative is about and what we're about and what we've really expanded is providing the services and support and programs and interventions so that we don't need to rely on that approach in the first place. And that's really what we've been doing. So when we talk about 5 probation officers, it's not just 5 probation officers doing the same kind of work that we were doing 10 years ago. It's 5 probation officers who are connecting community members, families, young people who need services with those evidence-based treatment programs that we have, things like multisystemic interventions, family functional therapy, wraparound services, juvenile justice diversion and treatment programs. All of these are community-based programs, and they're all programs in which we can provide support for young people and families. We can meet the families where they're at. We can come to them literally inside their homes and provide those things to them. I'll note that many of these contracts are in fact part of contracts that this board has created as part of other initiatives, such as the Title IV waiver initiative, which continues to be very important in making these services available to young people. But really, as I've emphasized, it's a difference in approach. What does that look like in real terms? Well, it's not just 5 officers. 2 of those officers we have deployed to schools. 2 of them have been assigned to community incubator sites. But beyond that, the probation department has matched that with a big dedication of our own internal redirection of resources so that we can staff out all the community incubator sites. Today we have officers at all the major school districts: San Juan, Sac City Unified, Elk Grove, Twin Rivers, I'm forgetting one.
Folsom Cordova.
Help me? Notomas, thank you. We've got officers in all of those schools. We've got officers at all the 7 incubator sites, and what's important now, the difference is the relationship, and that we're able to connect families and young people to those services. I would like to take a minute to recognize the team who's here today in the back. If I could ask you to stand up from the probation department. We have Cliff Foster, we have Larry King, Jose Mendoza, Diaz Mendoza, we have Mark Coleman, Andy Jang, and our supervisor, Ray Lozada. She's very shy, but our chief deputy, Shonda Cruz, is really doesn't want the limelight. And I think if you talk to our colleagues in the incubator sites, they'll tell you that those officers are essential. They're doing good work. We have a photo. I made a trip out and had a chance to visit with a couple of the incubator sites. We see Mr. Lamar Thorpe and Ms. Rihanna Davis, who are here in the audience with us today from the Oak Park site. Thank you. It could have been a photograph from any of the 7 sites, but we're just in the interest of time, we'll pick one. This is what it's about. This whole initiative is about relationships. When you go to the sites, and I've been doing this business for a long time, I know what to look for. I've been in initiatives before where you go and supposedly there's teamwork, but I say, where does my officer sit? Oh, it's that cubicle, and I go over there and it's an empty cubicle, and you can tell the computer's never been turned on and no one's ever sat there. When I visit the sites, I see just the opposite. I see a lot of teamwork, a lot of relationship. They're talking about working together. They're talking about, and it's not just probation, it's with all the county partners, with DHA, DHHS. There's a real teamwork, and I can tell you this teamwork is new. It's a part of this initiative. It hasn't always been there. Our presence in the community has been a certain kind of presence prior to this work, and as part of this initiative, it's a new kind of presence. I'll share a story from Officer King in the background. Many of these officers are also assigned to some of the school sites, and there's a bigger team of officers who are part of the school sites as well, and they'll sweep through the schools and check in. Officer King has a box at American Legion High School where he can get notes from school staff, and before he comes to the MDT team, he'll stop by and get information. And for example, one of the pieces of information he got last time was that a young woman, a young mom, was in need. She was expecting, she had a baby on the way, and she wasn't aware of all the services and support that exist out there through the various contracts, through our partners in DHHS and elsewhere throughout the county. But it's that relationship that now exists is able to connect that young mom to those services directly. And note, the most important part of that is what I didn't say. Nobody got arrested. No babies were taken away. You didn't have to come into the justice system. So they're looking at that PO in a new way. They're looking at that social worker in a new way, that think, okay, maybe this person's here to help. Maybe this person's here to actually provide some of the services and support and not just be there when it's time to make the arrest. So that's been the really transformative thing as a department. We're excited to be a part of this project, and it's great to know that at all 7 sites we see this kind of teamwork up and running. Thank you very much.
Thanks, Chief.
Any questions from the board before?
Any questions?
Thank you.
Good. Thanks, Steve. Thanks for all your engagement and certainly leadership at your level as well. Okay, Dr. Heller, Lee Seal have presented. I have a list of speakers. I don't know if the steering committee, do you want to take these in the order that I was handed? And I didn't know what the next, I have Pastor Banks, but I don't know, Chet, were you just taking the order?
No, we're going to present first.
Okay. All right, very good. We have that. So I'll call forward, then those are going to do the report. I didn't know who that was. So those are going to do the actual presentation of this steering committee report, the Black Child Legacy Campaign, and then we're
going to present the report. I think we're going to start with a short video. And
okay.
Let me just say.
And I believe the Metro Cable folks would run.
Sure. Okay. Go ahead, Jen.
Well, let me just start by thanking you for having us here again. We were here about a year ago to do our first annual report. And I am Chet Hewitt, President and CEO of the Sierra Health Foundation and co-chair of the Steering Committee to Reduce African American Child Death. And I'm joined by my co-chair, Dr. Natalie Woods Andrews, who will be presenting with me this morning as well. So before we get going, we'd like to roll the video. I think it's a good example of a lot of the partnership that Dr. Heller and Chief Seal have been speaking about.
Okay.
When you're so far away from everything that's part of your normal life, and there's nothing you could do about those things. New spaces bring new thoughts. Sometimes you be somewhere, you have a thought that you never had you been somewhere else.
Some never been outside of the city of Sacramento. Some youth have never experienced the open, woods and been in the mountains and experienced some of the activities here, like canoeing and high roping and low roping and some of the bonding activities that we're doing. They've never experienced that.
They came from several different communities in Sacramento, but up here they became strong together as one.
I thought like that, from us being all from different neighborhoods and stuff like that, it would start problems because there's different hoods and gangs and stuff like that. So it really touched me that we all were able to get along.
So here at Black Child Legacy, we work off relationships. Every single area from the north all the way to the south have specific individual relationships with these youth.
We had this activity where it was more like a step forward if you've experienced it, and realizing that a lot of my sisters have been through a lot of the same experiences that I have.
You think you're in something alone, and then you see 15 other girls going through the same thing.
I took back a lot of sisterhood from the camp, lifelong friends.
We got the elders here. We got us as the in-betweens, the elders, us and then the youth. Then it's not about just myself and the other mentors doing all the talking, but also it's interactive with them to give them the opportunity to talk back to us, to be involved with the activities. The activities are interactive. It's not just let's sit back and talk and listen and okay, go out and play.
You never know what someone's actually going through, and the camp actually showed me that in that room, I don't know, it felt kind of like a safe haven. So hearing everybody, they trust you, so it's oh, I trust them too.
I feel like city life, people are much more about doing their own thing versus camp. It's these are the people you're with and they're your family.
By bringing them here at the camp allowed us to be very open with them and allowed them to be open too without being judged. So Black Child Legacy Campaign, it has its own destiny. And we do have a goal that's been set for what we want to accomplish in the amount of years that we've been allocated to do it. And I'm confident that we're definitely going to make some progress.
You know, we chose to show that video because, as I think the folks who spoke before me addressed, that this is really about relationships. This is about connecting with people and connecting with communities in very different ways. In 2013, we presented to you our strategic plan. We actually talked about the needing to build an architecture to deliver services in a new way. In 2014, we delivered our implementation plan, which I think expanded on that particular idea. We talked about community incubator leads and how they could actually lead this particular work and provide a forum for county departments to really build trust and connection with community. You know, we talked about engaging our young people in that particular work and having them work across their traditional community boundaries. They could get to know kids from Oak Park and South Sac and Lemon Hill and Fruitvale and Valley High. And you've seen that, I think, depicted in this particular video where our kids would come together in the park in a camp-like setting to build that trust and respect. And so many of the things that we had hoped for in that plan are actually in action, in operation. And I do want to call out, I think, the tremendous work that our county departments and partnership that they've offered and afforded to us at the steering committee to actually make the kind of progress that I think that we can collectively be proud of. So I want to thank Chief Seal and Sherry Heller and Ann Edwards and Nav Gill and others who have helped lead this effort. I also want to call out two people independently, and that is Kim Williams, who is, I believe, in this audience. Kim, can you stand up? We also have Kim back here. Kim, could you stand up for your work at CPS? And Gladys Delaney, who I also want to point out. And I say this because the multidisciplinary teams that we talked about really is, I think, a demonstration of services being delivered very differently than they were before this effort got started. Can I have my first slide, please? The Black Child Legacy Campaign, which is the rebranding of the Steering Committee for Reducing African American Child Death, really is to give that a more hopeful message. And so the imagery and the title under which we do business, you know, really is about bringing hope and potential and possibility back to communities as well. It has four major parts. We have the community incubator leads and the multidisciplinary teams who are at the center of community. And could the members of the teams please stand up? These are the real champions of the work. We have members from some of the CILs who are in the audience today. Could you please stand up? And I would challenge anyone to pick out who the county representatives or employees were, because you couldn't tell if you looked back there. They were just members of the CIL teams. That's the kind of deep relationship that I think the chief was speaking to as well. Some really fabulous work taking place. Of course, we have the steering committee who helps lead that work and is a coalition of some really dedicated individuals who bring thought, leadership, as well as community activism to the table. We have our Community Leadership Roundtable, which is our powerful grassroots support network. 20 of these individuals are now crisis responders. They are trained and certified crisis responders. I'll share a quick story later on about some of the work that they are actually doing, but they give us this authentic connection to community, and they need to be applauded for their particular work as well. And then, of course, we have our Technical Assistance Resource Team, and that is our ability to build capacity by offering training and capacity building support to those 7 community organizations who are leading the work in those particular communities. Next slide. Our approach is a targeted but universal approach in the 7 communities that you see listed here. And people say, what's targeted but universal? That is, we are very focused on reducing the disproportionate African American child mortality rate. That is the charge of the committee. But we also believe that good policy is good for all children, and we are working in ways that we believe will benefit all children. Last year, the story that I used to kind of describe this was the work that was led by Dr. Ethan Cutts and Diane Galati, 2 members of the committee who actually put in place the Safe Sleep Assessment Protocol that is now in all 4 major hospital systems. That protocol, which does the training around how to sleep your baby safely, was born of our effort focused on African American children, but that is now for any child born in our particular region. Doesn't make a difference about your socioeconomic status, your race, or ethnicity. Every family is taught how to safely sleep their child. I think it's been reported that having a crib or a safe sleep environment is not sufficient, but it is the knowledge and training that's gained for those parents through that particular process we think is having an impact on reducing some of those rates, and of course we hope that continues. Of course, we are focused on the 4 leading causes of death, and unfortunately they remain the same as they had been historically: perinatal conditions, infant sleep-related deaths, child abuse and neglect, and third-party homicides. The latter 2 will be an increasing focus of our work going forward, as I think there's a lot of good work being done around those first 2 causes of death. Next slide, please. Currently, yes.
Excuse me, can I interrupt before you move on? Because I think it's an important point to mention about statistically the rates not being or being where they were before. But I want to make sure I understand. We've been drinking through a fire hose this morning in terms of data, good data, necessary data that we need to digest, to understand, not just the disproportionality associated death rate in the African American childhood population, but for all children in the county. Is this really a case that death rates are going down, but they're not going down as fast for different ethnicities? Is that one way to characterize what's going on here?
That's accurate. We've had a kind of ongoing trend for a decline in overall child mortality rates. What we're not seeing happening as quickly is the reduction in the disproportionality between racial and ethnic groups. And I think that the reason why the final recommendation from the death review team was to continue this particular work is because I think they remain focused on the fact that we've got to do more and move faster than that decline of overall rates if you want to reduce the rates of disproportionality.
Good. I just wanted to point that out because I think if you just leave it at, the data or the rates are unchanged, that gives you a different impression than if you understand the context, which is all death rates are beginning to drop.
That's right. And I think that the highlight, as was reported, was that you are seeing declines in rate of disproportionality for African American children in certain categories of death as well.
Like sleep-related.
That was what I think Sheila was flagging when she was talking about, there being some array of hope, I think, in all the work that's really being done.
Thank you.
Currently our campaign is working on, and I said this earlier, the co-location of services, in partnership with our community incubator leads and public agencies, providing a wider and growing array of wraparound services. We're not only doing CPS and probation, you can actually do eligibility services for food stamps and other supports to address issues of poverty within those sites as well. This notion of creating community decision-making and keeping community engaged in this process, which I think is one of the most important and transformative aspects of this particular work. This is not something that's being done to communities. This is work that's being done with communities, and for us, that's a sea change, not just one about language, but about the potential to be even more successful than we have been in the past. Clearly, infrastructure for community capacity building is being ramped up. We're very excited about that. And we are creating a kind of social justice youth development opportunities for young people that will increasingly look at economic opportunity. So our work with SETR and jobs and employment being a focus of that particular work. But even things about our own education and knowledge about what might work. I think Supervisor Cerner, you were able to spend some time with our participatory action research young people. Those were the folks who were at camp, a dynamic group of young people who are the future social scientists in our particular community, who are doing some impressive work and gathering knowledge that's shaping the way that we actually do the work going forward as well. Next slide. You know, a big part of our work is really around raising visibility, influence, and support for community investment. And to do this particular work, you know, we're investing directly in many of the CILs. We're educating both ourselves, the CILs, and community about what needs to change in order to reduce mortality rates. We're building solidarity with faith leaders and social service providers, both public and private, including some private partners who are now participating, like HealthNet, which is supporting some of our cultural broker work. And we continue to build and support organizations to strengthen the infrastructure within communities as a whole. And some of that's being done through re-granting, where you have some of our CILs who are now making grants to small organizations or small groups who are doing really great work in their community. Folks who would never be able to get through one of our contract processes and respond to RFP, but folks who we know have real walkabout, kind of authentic relationships with communities, and we think that's pretty amazing as well. I'll end before I turn it over to my colleague with a short story about what this work looks like and how important it is. Early this year, we had 2 young people who were shot, and 1 who lost their life. At 2 o'clock in the morning, while this is being dealt with and a young person was struggling with their life to stay alive, we had between 150 and 200 young people at the hospital in the emergency department at UC Davis. This was now about 2 o'clock in the morning that this was going on. And I can tell you that having 150 to 200 young people with very little adult support at that facility at that time, of course it's a hospital, it's not designed to manage this, really is, you know, provides a potential for not good things to happen when they were to leave that particular space. Not because they'd go out and just simply commit some crimes. We're not saying that. These are young people. They have emotions. They've been traumatized. They are concerned about what's going on around them. But in that moment, we had a number of our crisis responders who got up out of their beds, who left their homes, who showed up in that hospital, who provided support to those young people so they could process what was really happening around them. There were things that we did that may seem a little bit unusual. We had expenditures for food because we had to feed some of those children in order to get them, you know, to a place where they were really prepared to hear what we had to offer them. Right? We had to make sure that folks got home safely, right? Because that was an important thing to do, and not have potentially other harm be done to the community or to individuals because folks were in a state of grief and trauma. So, you know, what I really want to thank you for before we talk formally about our report is to take the risk to do something that was really, really different. To not be bound by the constraints that we usually impose about programming, about how we typically do things, whether food is an appropriate reimbursement. You know, if we're going to really make a difference in this particular work, I think we're going to have to continue to do things that we might not ordinarily do, in ways that we might not ordinarily do them. And I think if we can commit and maintain our commitment to that idea, then what you'll see in the coming years is additional progress on this particular issue around disproportionate African American child death. I'll stop at my summary there and turn it over for a formal report on the report that you have in your hand, which will be given to you by my coach.
Okay, thank you, Chet, for your presentation, for sharing.
Well, thank you again. It is our pleasure to just come before you to share a little bit more information about the annual report that you do have before you. This is our opportunity to provide you with an update in terms of the progress of the work that we have been chartered to implement on behalf of the Steering Committee on Reduction of African American Child Deaths. I hope that as you look in the faces in these rooms, and as you look at the faces on the slides, you will see the lives of real people who demonstrate to you the importance of the type of infrastructure, the type of support that has been needed in our community, something that hasn't existed. What I'm going to share with you is a little bit of information in terms of some of the implementation strategies, the milestones that we have been able to achieve, also taking a look at the accomplishments that have occurred thus far, as well as the next steps as we move forward. One of the things that I think is important to share with you, again, just a reminder of why we're doing this work. Any life lost, of course, to us is a crisis, but our specific charge is to reduce the African American child death to disproportionate number and rate of death by 10 to 20%. And so that is our charge to do by 2020. This has been a movement that has been focused on a specific purpose. We have identified key strategies, and also it is our goal to make a collective impact in our community. The work that we are doing in this particular plan is based on 5 key components, strategies that are interdependent. They all work in tandem with each other. And as you can see on this slide, and I won't read each one of them because I'm going to unpack them in a moment, this is our opportunity to really transform our community by working together in all 5 of these particular areas. The first that I'd like to unpack for you is focused on promoting advocacy and also policy transformation. This is our opportunity to take a look at some of the accomplishments that have occurred in this particular area. First, I'd like to share with you, as my colleague has mentioned, that we do have 6 community leadership roundtable that have been set up in each of the communities, really building the capacity of those who are volunteering their time to really learn from each other and also to support each other and serve as representatives of the community in leadership roles. They come together on a bi-monthly basis to make sure that they are staying connected within their particular communities. At the same time, as my colleague has mentioned, we have been able to put in place 20 community leadership roundtable members. I know the slide says 17, but we recently brought on 3 additional individuals to be a part of this work. And they are now certified crisis responders in the community. They are the go-to individuals, the cultural brokers, if you will, in all of the communities that have been set in place. This has also been our opportunity to make sure that we're building their skills, their knowledge, and enabling them, using their abilities to make that collective impact in their own communities. The third piece that I'd like to share with you is focused on our faith leaders. And the key in this particular areas is that we've had a few opportunities to bring our faith community together, representing our local churches and our areas of worship to come together in a collective way that they have not in the past, focused specifically on the Black Child Legacy Campaign. We have been able to hold an annual prayer breakfast to bring these individuals together, as well as the Glory Conference, which has been a great way to bring a number of individuals across Sacramento County to really take a look at how can we look at our faith leaders to take a leadership role. One of the things that we know has occurred in different communities is specific to looking at the infrastructure that we have in place with our community incubator leads, taking the lead and responding, but really engaging our faith leaders, working hand in hand, side by side, to make a difference. There are so many resources that are available in areas of worship that are not necessarily tapped into. So our faith leaders are now stepping up as leaders in the community. They are the ones who are leading the peace walks each week. They are the ones that are coming to the Black Child Legacy Campaign to say, what can we do to support our communities? The next area is focused on equitable investment and systematic impact. And in this particular area, we have 3 accomplishments accomplishments that we would like to highlight. And one, it is focused on just launching a countywide evaluation design where we are engaging all of our community partners to really focus in on how do we make sure that the work that we're doing is specific and it is going to render results. We were able to host a results-based accountability forum for over 100 participants. It included all those who are a part of the Black Child Legacy Campaign, as well as city and county representatives, coming to learn a little bit more about how we will move forward together so that we're all on the same page. At the same time, we've been able to secure some funding for cultural brokers throughout our communities, specifically looking at the North Highlands and the Foothill Farms area, as well as Del Paso Heights in the North Sacramento area. We've been able to do this in partnership with the county, but at the same time, being able to leverage some fundings from HealthNet to make sure that we are providing some support in our targeted neighborhoods. At the same time, in this particular strategy, we are charged with assisting and helping to develop the Interagency Children's Policy Council, and that is one piece that we initiated some work in this particular area, but we've not been able to move forward at this point, and we'll talk a little bit about that. We're looking for just very strong outcomes to make sure that we have a collective group coming to the table. I know that as Sheila was up here talking about a recommendation that they are moving forward, we also believe that it is important to bring a number of community partners together, representing a diverse group of stakeholders, really to address this particular cause. This next area is focused on a coordinated system of support. And we know that any strategy that we put in place, it is important that we move forward together in a coordinated way, in a seamless way. And I'd like to just give a shout out to this particular team, as well as the other community incubator lead teams that have been charged to do this work and service those hubs in our community. But in this slide, you will definitely see the collaborations of our community incubator leads. In the center, Ray and his colleague, as well as Janelle from CPS, and you have Dominique, and you have individuals from social services, to make sure that, again, they're working as a team. As Chief Sill said, you cannot tell the difference between who's working there as a county employee or a city employee, or who's a community volunteer. They are all in this work together. And in each of the community incubator leads, you will see that SETA is at the table, probation is at the table, DHA, DHS, they're at the table. It has become a one-stop shop for individuals who need services in the community. One of the challenges that we're facing is that the word is out, that there is a location that you can go, a trusted location where you can go and tap into services. And so those who are not necessarily in those targeted neighborhoods, they are coming to seek that assistance because they know that they can go and get some support. So our community incubator leads have been trained to make sure that they are providing support to those who are walking through the doors, but also make sure that they're connecting them if they are seeing individuals who are from another zip code area, to make sure they do that warm handoff to make sure that they are fully served. This has been a great opportunity, again, to create that buzz in our community, that there is an infrastructure that is in place to support this work. And so our community incubator leads have also been able to do some of the many granting opportunities where, as my colleague mentioned, there are those who would not be eligible or who would not take the initiative to write their own mini grant, but they are able to come up with some very innovative ways to support their community. You can see that the 7 focus neighborhoods have been identified for us to focus our work, the work of the community incubator leads, the community leadership roundtable, and the steering committee really is doing that targeted, however universal focus in these particular areas. The next aspect is focused on data-driven accountability and collective impact, and this is our opportunity to really identify those short and long-term goals, really taking a look at the participatory action research and some of the other aspects that we feel are really important to, number one, understand the the quality of the program, the services, and the infrastructure that is put in place, and to make sure that we are moving forward in an effective way. So I'd like to share with you that we have had an opportunity to conduct site visits based on the recommendations of the evaluation work group team to come up with 9 indicators of quality that show the impact of the work that has been put in place so far. And on this particular slide, you can see that it is a scorecard of what our community incubator leads in our community work looked like back in December as a comparison in terms of what it looks like in July. And you can see there is a substantial difference in terms of just beginning this work and putting this infrastructure in place and now really settling in and building that capacity within our communities, focused on skill development, capacity building, just making sure that anyone who's providing that service is very knowledgeable about our particular focus of work. With our work, we have been able to provide technical assistance and support. And with this work, we've also been able to launch what we shared with you as the rebranding of the steering committee's work into the Black Child Legacy Campaign. And so we focused a lot of time this year in building up the website, providing weekly blasts to those who are interested and want to know a little bit more about the work that we're conducting. And we really have developed that countywide approach to immersing our community in terms of the services that are available. We've been able to engage our community with direct outreach, and we really have positioned the Black Child Legacy Campaign really as the focal point in our community for media and for different outlets. And so I'd like to share with you just a list of some of the traditional and non-traditional media outlets that we have been able to engage on behalf of the campaign throughout the year. The Black Child Legacy Campaign has been featured prominently on many of these venues, and so I do want to thank them for the support and also for the coverage, because it is important to build that capacity. A lot of the work that we do, of course, is through this direct outreach, but it also is through word of mouth. So the more that we inform our community, the better we can really build this campaign and move it forward. So I'd like to turn this back over to my co-chair to share with you just a summary of our work.
And I'll do this quickly because I know we have a lot of folks who are waiting to speak with you as well. This is just a one-page summary of where we are. CIL and Roundtable Training Technical Assistance, it is up and running. You have seen the impact of that, I think, in MDTs. Interagency Children's Policy Council kind of stalled. We're trying to figure out what the alternative strategy is. I think this idea about better coordination across all the moving parts, something we talked about, and if I remember correctly, Chair Natoli, is something that you really advocated for when we presented our first plan as well. And we need to re-engage with the county to figure out how to get that up and running again. I think it's even more important now that we have infrastructure in place and operating so that we can continue to work at a common purpose as opposed to getting sideload or at working across purpose. And of course that wouldn't be intentional, but there is a lot happening as we speak. Technical Assistance Resource Center, what we call our TARC, it is up and running. The NVTs, as I said, up and running. The quality assessments was that chart kind of pre and post. You've seen where groups rated early based on those qualitative assessments across those 9 measures. You see where they are now. That's an ongoing activity as we expect to see increased capacity over time as well. We are in the process of collecting data, research teams, young people engaged. I think our PAR research strategy is going to produce, I think, a lot of great information for us to build off of. And then, of course, continue to work collaboratively with CPS, probation, and other county departments who have been extraordinary partners in this work to date. We're really looking forward to the launch of the Cultural Brokers Program, and we're hopeful that'll have some impact on some of that CPS data that you've seen earlier, where clearly there is more ground to cover. Next slide. Next steps, talked about them, begin the peer-to-peer phase of quality assessments. So now we're going to move from training people to have folks being trainers for each other. All right? So this will be a much more sustainable approach using a peer support model. You may be good at communications in your community. You may have a great budgetary system. Can you really help across communities to actually continue to build capacity. The crisis response, we've had a spate of a loss of life over the summer. Those certified trainers, I'm telling you, as someone who's been out on a few occasions, it's some really needed work. It's a hard place to actually be. And so our efforts to continue to support them, to respond to those crises, but also to take care of yourself. There's but so many funerals of young people you can go to without it having an impact on the communities and families first and foremost, but also on the folks who are responding to that. These new untraditional communication strategies, something that we'll continue to pursue, as well as national conversations. We had a group that presented at Proctor, which is the Children's Defense Fund's national a gathering that's held in Tennessee at the Alex Healy Farm to talk about our work, and we'll continue to talk about it beyond the boundaries, jurisdictional boundaries in which we're operating. Of course, the Social Justice Youth Development Program, again with a focus on economic opportunity and employment for young people. We think that's driving or contributing in pretty significant ways to death and injury, particularly amongst older children. Of course, the cultural broker efforts as they get launched and up and running, not only to get them started, but also to strengthen them once we hit the ground and we are in operation. And then, of course, always continue to document the success we're having, the knowledge we're gaining, and reporting back to you so that we can continually improve the quality of services that we are delivering. Next slide. We thank the chief. He had a slide of one group. These are all 7 teams. I know we say Arden twice. That's a mistake, but these are the teams who are operating in all 7 of the communities. Next slide. And of course, I want to say thank you to the volunteers who make up the steering committee, who over the past 2 years I think have done tremendous work, who have stayed committed, who continue to show up for the meetings and offer their insights and talents so that the work that we are engaged in has the best chance of being even more successful than it has been to date. So with that, we conclude our presentation and take whatever questions you have.
Thank you to our co-chairs, and we have a couple questions from supervisors. Supervisor Kennedy.
Actually, not a question.
Okay.
Before we get to all of the speakers, I wanted to, really commend the work that the co-chairs, the whole committee, and all of the people in the audience are doing. It's not lost on me that 3 of the focus neighborhoods are in District 2, and we do a lot of very important work up here for the community, and nothing is more important than the work you're all doing. It's frustrating that this good work takes long to really see the benefits, but what I see here, what I heard today, I don't think there's any community in the country that's doing anything like this that I know of. So I commend you, and let's keep it up, and whatever we can do to help, we're here.
And we commend you for your support too, all of you. Yeah.
Thank you.
Thank you.
Any other? Yes, Mr. Cerna.
No, I was just going to say I wanted to also express my gratitude for all the tremendous work. I stay in touch fairly frequently with various component parts of the effort on a weekly basis, quite frankly. But since Supervisor Kennedy brought it up, he mentioned this work and how unique it is and robust it is compared to what's going on in other parts of the country. Maybe, Chet, that was your cue to maybe express what has been shared with other parts of the country in terms of this effort?
Mm-hmm. Yes, I've testified for the Federal Commission on the Reduction of Child Abuse and Neglect deaths. It's good to see that we're using one of the recommendations that came out of that national work is also contained in the County Death Review Team's recommendations going forward. We continue to be and provide consultation to other counties, both within California and beyond, who are interested in our work. And I will tell you, one of the questions I get asked more than anything else is, how did you get the political support to do this? We, unfortunately, are not the only county who is grappling with disproportionate childhood deaths of African American children. but we are one of maybe 2 or 3 counties in this country who have found the political will to engage the full community to try to resolve that challenge. And in that, I know we've gotten a lot of commendations, but we'd like to offer one back to each and every one of you sitting behind that dais, because it would not have happened but for your support.
Well, big collective thank you to everyone in the room for all your efforts and for all the work that goes on in all the realms that make this, very important. And I think it'll be a life-saving project, obviously, and a life-changing project in many, many ways, both individually but collectively for this community. So, again, thank you so much for your leadership and good work and for the presentation. We're going to hear from a number of folks here. I just want to do a little agenda management real quickly before I call on the speakers. Understand it, we're going to move to the afternoon portion. Afternoon's going to bump down a bit here, I think, recognizing we're already afternoon. And we're going to take the County Children's Coalition Work Plan report after the break. We're going to finish testimony here on this.
Yeah, what we would suggest is that move the item to 2:30.
Okay.
Have a lunch break. We still have a couple closed sessions we want to talk to you about, but this afternoon come back about 2:30 time to hear item number 35.
And then everything else will bump down below that, so the 2 and 2:15 items?
Yeah, they will bump down accordingly.
Okay, so we'll...
Just sequentially, we'll start at 2:30 with closed session, then we'll come back and do the Children's Coalition and all the other items after that.
So we're going to finish this item, so stay with us, and then we'll break, we'll have a closed session, and come back at 2:30 back in to start with the 11 o'clock item. So again, apologies to those folks on the second one. County Children's Coalition, but we will hear that before too long this afternoon. So, okay, with that, then I'm going to go to our speakers. I'm going to take these in the order they were handed to me. I had clear instructions on that, so I think Pastor Banks is first, and then Steve Garrett and Danielle Lawrence will be our first 3 speakers.
No Pastor Banks.
No Pastor Banks? Okay. All right, then Steve Garrett. And Steve will be followed by Danielle Lawrence, followed by Colleen Kelly. Steve, good afternoon.
Good afternoon, Mr. Chair and honorable members of the board. I'm Steve Garrett, acting public defender, as well as I'm honored to be a member of the steering committee. And I know you're very busy. I'll try to be quick. I just want to say it's really a great honor and a responsibility to work with the great people I've seen here. The grassroots effort that they have put together is honestly startling and amazing to me. I've personally witnessed great work going on at Liberty Towers and at South Sacramento Christian Center. Just amazing things they do, and that's taking away not at all from the other great work, but I've personally seen that. And I want to just say it's just such an exciting opportunity. What I've seen for you, the resources that you've directed here are just producing great value, in my view, for the community. We've seen so much energy. There is an amazing talent and energy in the group of people that are assembled here, and it's astonishing to see them all work so well together. And I'll close because I know you have 1 million people to hear from. So I'm very hopeful that change and positive change is going to happen in this community, and I thank the Board of Supervisors for that. And that in this kind of work, it's rare we all get to feel like we're on the side of angels. So thank you so much for what you're doing.
Good. Thanks, Steve. Appreciate it. Okay, next Danielle, then followed by Colleen, and followed by Brandy, Missouri.
Hi, Danielle Lawrence from Mutual Assistance Network, and I am representing the Art and Arcade Community Incubator Lead. I am just so proud and thankful for the efforts that we're doing in Art and Arcade. I will be introducing people that I'm working with, because one of the things we know, and all incubators will agree, that we can't do this work alone. And so I will be introducing some of our youth speakers who will kind of go out of order. So I want to ask Colleen to go, and then our youth, because they got to get back to school. So I thank you, and I just thank you for your efforts and your contributions.
Good. Thank you so much. Okay, so Danielle introduced Colleen, right? Yeah, Colleen, good.
All right, so my name is Colleen. Most of my coworkers and clients call me Coco. I am a member of the Community Incubator Lead, as well as a member of the Community Leadership Roundtable for the Art and Arcade area. Within both of these roles, I am a cultural broker for families. I am fairly new, but I have a small caseload nonetheless. Not only have I utilized a lot of these services that the Black Child Legacy Campaign offers, but I have been able to connect each of the families I work with to them as well. I was able to advocate for a client who was facing 30 days in county jail by speaking with the DA on her case and figuring out some alternative sentencing methods so that she would be able to maintain custody of her children and make sure that they were still attending school, doctor's appointments, and maintain their housing. I have another client who was in desperate need of housing for her and her 2 small children. We were able to sit down and work out a plan as to how we can make that happen and how we can maintain that. When I got this case, she had no child care and therefore was unable to work. Since working with her, we were able to establish child care and get her set up for parenting classes as well. I've only been working with this client for 2 weeks, and we're currently working on a source of income so that she can obtain and maintain housing. And these are just a few of the examples of the impact that the Black Child Legacy Campaign has within our community. And with your continued support, we can continue with these efforts of lowering the disparities within the African American community. Thank you.
Good. Thanks, Lauren. Okay, you just tell me who you are when you come forward, since you know what order you're coming in. I had Brandy and Sharia, but okay.
Hello, I'm here with my peers, my brothers and sisters from the Black Child Legacy Campaign. I wanted to open this up by sharing a piece that I wrote that had to do with our community. And after sharing this, that we will also share.
Okay, but tell us who you are, though. Tell us who you are.
I'm Sean Dustin.
Okay.
The senior at Encina High School. Thank you for the opportunity of being here. I really appreciate it.
Thank you.
And you kind of gave me a get out of school free card, so thank you for that. No, but
was that prepared?
So the piece that I wrote is about a real life situation that I went through myself from the perspective of me and the Caucasian officer that I encountered in the Natomas neighborhood I lived in. Dear officer, do you enjoy offing us? Do you see me as a threat? Fret when you grasp the Beretta, pressing your knee on my neck. I know I fit the description. I know I am a suspect. I know my rights, my mouth is sealed. Congealed by the conversational minefield you have set ablaze to which I should yield. I feel the steel on my wrist, tightening around my skin, grasping and tearing it open. All of this unfolded and there is not a word I have spoken, but I'm the threat. Release me so I can continue to rap. Maybe you assumed I do that because I'm black. The odds stacked against my matte pigment. Pigs equals imprisoned, face printed on a t-shirt. When I am coffin ridden, you're smitten with black children with bright visions, so I'm placed in the backseat, caged like some live meat, interrogated till you find something to call guilty. All of my life, I have been scared of you cops. Now I'm living my worst fear. I proclaimed I wouldn't falter, but I never thought I would be here. My whole body is shaking faintly, staring anxious, scared and angry. My body's where you'd be aiming. Hope my mom don't see me riddled in bullets along the pavement. I stare at you so you stare back. You glance at your police tablet. You say you mistook me for a similar suspect. Get out the car. Now, dear suspect, do you enjoy offing us? Do you see me as a threat? You see my cop car and instantly you disrespect? I'm just patrolling, rolling, hoping that somehow I'll protect. But I can't help it if you look like someone who was wanted. You seem nervous. Looks like I got the right person. You have your hands in your hoodie pocket. You just might be holding. Stop, freeze, get on your knees, hands in the air. I approach you, then proceed to roll up your sleeves. I move your arm but feel resistance. I jerk it to where it needs to be. Afraid if I'm not wary, I won't go home to see my family. Because kids can tote lead bullets. Bullets can hit my gullet. I can't stop you in any other way if you choose to pull it. You hate to see cops flashing their lights when bad things happen. You're smitten with white cops because media won't stop painting us as these villains that subdue and then pop, pop, pop. I get you off of your knees. I place you in the back seat for my safety. Then I begin my inquiry, which you won't answer because you'd rather refuse to speak. It may be an amendment, but that seems fishy to me. All of my life, I have been afraid of the unknown. Growing up in a home separated from the black households, was placed inside of a school where no black kids go. Media showed you as a common criminal. My parents normally discriminated. It wasn't subliminal. So when I was let loose into society, I didn't branch out. And now I'm looking in the rear view. You stare at me, so I stare back. I glance at my police tablet. Instantly feeling regret, I turn around. I'm sorry I mistook you for a similar suspect. Get out the car. Thank you.
Just tell us who you are. So and thank you for sharing that. So yeah.
Hello, I'm Kat Holloway. I go to Encina Preparatory High School. And okay, I guess I'll just start. I'm here to talk about why Black Child Legacy is so important to me and important to my community. I started this last year. I've been here for a year, and my sister just recently had a child. She's a new mother. She's really young, 22 years old, and to be honest, no one's really prepared to have a child. But going through what I have with Black Child Legacy, I was able to have a serious conversation with her where I could talk to her about certain things that I felt she needed to know that she didn't know, and that I could talk to her as first intern of Black Child Legacy, and secondly as a brother. And with that information that she learned, she was able to take care of her child and know that she has resources coming from a low-income housing where she didn't fully know how to take care of her child growing up without her mother and without her father like I did. And she took this information to inform other people that were thinking about having a family of the same age. So she was able to communicate with others and start a conversation to inform others just from what I told her. And that's how I realized that this work does have value, that it does actually touch people. And it started off with just my sister, but reached out to people that I didn't even know, that I didn't even talk to. Started off with just my sister and went to my neighbors, went to people in the community, went to people I don't know their name, but I see them on the street. But I know that they're gonna be able to take care of their children, be able to raise a family, and we don't have to go to any more funerals. So, yeah, that's my piece.
Thank you. Are others you going to present? Come on. It's all right. You're on television, so it's okay. No pressure.
All right. Hi, everybody.
Hi.
My name is Devontae Ray. I'm a sophomore at Encina Preparatory High School, and I'm going to tell you what we do. We meet every Monday from 3:30 to 5 o'clock. Right now, we're analyzing the data from the survey we just put out on child abuse and neglect. And hold on.
It's all right, Devontae. Just tell us what you're analyzing. Tell us what you're working on.
We're analyzing data from the survey we just put out. Mm-hmm. And so it's a long process. We've been working on it for 2 weeks now.
Wow.
But
okay, good. Thanks.
I got you. No, I got you. Yeah, I don't got this.
Okay. Good. Thank you.
My name is Sequoia.
Hi, Sequoia.
I'm a sophomore at Encina Preparatory High School, but like he was saying, we analyzed a bunch of data from kids that go to our school. It's anonymous, so we don't know any names or anything, and it's just simply asking questions like, if you were in your household getting abused, where would you go? Where would you be more safe to tell anybody? Where would you be afraid? Or just any information about that, and just to, I'm so nervous, oh my God. Just to, get to know, I don't know how to word this. Just to know things, intel, to know if the child is safe, and if they're not safe, where could you go? Instead of just, staying home in a place where you're not safe at. So you could have fear and, oh my God, oh my God.
It's all right.
And it's good to know that some of these kids that did say that they're going through this, they have a place to go. And they have somebody that they could tell, and and that they don't have to just be there and at the household that they,
It's okay.
basically to close us out, knowing that we have like a time constraint, with the surveys, we're basically gauging how our movement can help kids that are in need, people that face neglect, abuse, and any sort of detrimental situation. With our own community, me discovering this recently over the summer, I've had a place to go to keep myself out of trouble, keep myself occupied, and learn about a cause bigger than ourselves. It's definitely been an experience to just keep on learning, and throughout this we're also going to be running community outreach events and stuff like that could possibly maybe even bring in more people, volunteers that can learn about the program and actually just expand their knowledge. I think that this is a really good program, and just thank you, Phil Cerna, also for the opportunity doing this and stuff like that. I see you repping with the green shirt. I appreciate it. But yeah, so it's just, yeah.
My name is Ezra. I'm a freshman at Encina High School.
My name is Adrian Kukua. I'm a senior at Encina High School.
Great.
And we just wanted to come out here and say thank you to Supervisor Cerna and the Board of Community Supervisor. I'm sorry.
I just want to thank you guys for listening to us, because I look at us as the future, and if we can reach out to any kid that's in trouble, they gonna listen from us, not from grown-ups. They gonna listen to us because we're kids, but yeah, we just trying to help people, get people involved with our program, Black Child Legacy campaign, and we just trying to make the world a better place, like Michael Jackson says,
Okay, well, stand by. I know we have some comments by my colleagues, and appreciate all of you, your work as our Art and Legacy interns, but obviously your community members who care about yourselves, your families, your peers, and you're making a difference. So, Supervisor Cerna, Supervisor Kennedy, you have comments?
Thank you, Mr. Chair.
Yes.
So if I'm not mistaken, Kat, I think I've met you before when I was out there. And when I was out there, I think it was about a year ago, I had a chance to spend a morning with a broader group of Encina students that had really embraced and adopted the then RAACD cause and effort. And I got to tell you, it was one of the most inspirational things I'd seen in a long time to note that young people, everyone from freshmen to seniors out at Encina, were not only trying to understand the data and understand some of the recent policy decisions around the effort to reduce African American child deaths, but you guys have become practitioners. You are right, as someone just said. You're the trusted change agent here. It's not going to be someone in a uniform necessarily. It's not going to be someone in their 30s, 40s, or 50s. It's going to be you guys. So I really do appreciate you coming out today. I know public speaking sometimes can be difficult, but you guys did a great job, and just keep up the great work.
Hang on, Supervisor Kennedy.
Yeah, I just have just one comment, and that's, if you followed supervisors' meetings, which I'm just guessing you haven't, I don't say things like this often, but you blew me away, and particularly, young man, that poem was freaking phenomenal, and I want to say, you guys need to stop spending so much time in North Sacramento. Come down to South Sacramento, because we need you down there.
Well, I'm in the Freeport area, so it's cool.
There we go.
Well, very powerful words, powerful actions, and obviously it rings true to the work that you're doing. So go forth and continue to do good, and come back and visit us from time to time. So, yeah, thank you.
Definitely will. Thank you.
Thank you so much. Okay, I'm way out of order here, so I don't know. I got Brandy and Sharia, and
that's a very tough act to follow.
Yeah.
But my name is Brandy Missouri. I'm with Department of Human Assistance, and I'm also an MDT representative with the Art and Arcade CIL. I have with me Heather Gonzalez. When I first started working with the Black Child Legacy program, I was kind of nervous because I already was enjoying doing what I was doing, so I didn't know what I was getting myself into. With that being said, making the transition of being just a regular DHA worker to a Black Child Legacy DHA worker has been an amazing accomplishment. I can't even describe the feeling, particularly with the new service design that we have, the call center model that started with DHA. I felt like that was going to make me hate my job, a little bit, not getting that customer contact that, that I love so much. So making the movement was the best decision that I've ever made. I've been able to work with families directly. I've been able to help them. I've been able to work with an amazing team. We have built a great relationship, and I'm just so excited of everything that we're doing. So thank you.
Thank you, Brandy. Okay.
Hello.
Hi.
Hi, my name is Sharia Holmes.
Hi, Sharia.
As a community leader, this is my first time, I'm a little bit nervous, but as a community leader for the incubator from Arden Arcade Community Center, I started as a mother going through birth and beyond, and I got approached before I completed the program about being a part of the community because I reached out to a lot of community mothers of the things that I were going through with my daughter. My daughter has been born with birth defects. It's the one back there that makes all the noise. And also my son has been born with birth defects. But as a mother, I didn't let that stop me. I went out and spread awareness out to people about that, and my visitation worker seen that, so she brought me in, and I was really just stunned, and I'm just now being able to get into with the Black Child Legacy, which I'm really just stunned as much as you guys are.
Great.
Recently, yesterday, me and my daughter got to be on a brochure with another program, and I went ahead and told my team that. So they're really excited about the brochure, and I'm really excited about it as well. It shows that I'm doing something and very constructive, and that I can go out and teach other parents what it's like. I also facilitated with and co-facilitated with the Safe Sleep class and spread awareness out through my friends and family. So thank you guys so much.
Thank you, Sharia. Great. And thank you, Heather, for coming down. Okay, we next have Kim Williams. Kim's followed by Demetrius Stone and Tanya Bean. Hi, Kim.
Good afternoon. I'm Kim Williams. I am the Hub Director for Sacramento Building Healthy Communities, and we are also one of the community incubator leads for the Fruit Ridge. We're the community incubator lead for the Fruit Ridge Stockton area for Black Child Legacy, and it was a great opportunity for us with Building Healthy Communities because the work they're doing aligns so much with the work that we're doing. We're also in the same area. Our boundary areas also overlap with each other, and so it was just a perfect marriage, I like to say, of leveraging resources and opportunities and expanding the work even broader and far out and reaching and touching more lives. So we're real excited about this program. We've been able to see some wonderful things happen. Excuse me, battling a little cold. We have our CIL is a little unique in that we are all housed in the same area. We're all in the Fruit Ridge Community Collaborative over on 44th, and so all of our partners, we've been able to bring folks together and take the opportunity to resource our partners that are already working in the area and already doing some fabulous things, and giving them the opportunities to really focus and narrow their work to really reach the population that we're trying to serve here. And so it's not BHC doing the work, but it's again in that collaborative spirit that we completely believe in, because we know this work is big and it is huge and it is important. It's a life and death situation for our babies out there, and it can't one agency cannot do it alone. It takes a multi agency initiative to be able to do this. And as we all come together as a collaborative, we're going to see the kind of change that we need to see, and we're going to see the lives of our children exist so that they can grow up and continue on the work that we're doing on their behalf now. So we're really excited. We have some partners that are going to share. One of our community roundtable leaders are here with us, and she's a powerhouse. She loves this work. She's a champion for us, and she's going to share. And we also have one of our partners, Demetrius Stone, who is going to share the work that they're doing around child abuse and neglect.
Great. Thanks, Kim. Demetrius or Tanya, whoever wants to go. Hi, Demetrius.
Good afternoon, Mr. Chair and the rest of the board of supervisors. Thank you for giving us the opportunity to come and share the work that we're doing. As Kim mentioned, first of all, my name is Demetrius Stone. I'm the Director of Programs at Pro Youth and a proud member of the Fruit Ridge Stockton Boulevard CIL. It's a neighborhood that I grew up in, so it's really important and personal to me that we make this a very successful initiative. Our role with the Black Child Legacy Campaign, and specifically the Fruit Ridge Stockton Boulevard CIL, is to help reduce child abuse and neglect in the Fruit Ridge Stockton Boulevard area. The challenge with anytime you're delivering child abuse and neglect prevention classes or sessions, the challenge is no one thinks that they're a bad parent. Everyone thinks that what they're doing is for the best of their children. So overcoming that challenge, some ways that we've done that is just making the community aware that our collaboration, as Kim Williams mentioned, we're all essentially housed in the same building. Just making sure the community is aware that our collaboration is even existing. Part of that, we were able to successfully have a great trunk or treat event at the Fruit Ridge Community Collaborative, where we had an estimated, I believe it was 400 families that stopped by. We had some of the probation officers. Officer King was there. He didn't dress up, but he handed out candy, so we really appreciate that. A great opportunity just to make the community aware of what we're doing. One thing that we're doing to address child abuse and neglect is not by simply having classes. First of all, we wanted to make sure we could secure a group of parents who would be willing to listen and whose ear we would have. So we've been able to partner with Oak Ridge Elementary School on Martin Luther King Jr. Boulevard. And we're having what we call family socials. So they're not so much as classes, they're just family socials where parents can interact with their children, and we talk about the importance of overcoming trauma, whether it be self-inflicted trauma or trauma from family members in your environment, community members in your environment, and just making sure that parents are aware that they can change the narrative and reduce that trauma that they've experienced and prevent that from passing it on to their children. So just one of the things that we're doing, I'm going to let Tanya Bean come up and talk about some of the other great activities, including some of our work at Jack Bean Park.
Great. Good. Thank you, Demetrius. Okay, Tanya, and then Tanya will be followed by Ray Green and Renee. So, Tanya.
Hi, I want to thank you guys for allowing me to speak.
Thank you.
First of all, my name is Tanya Bean. It's hyphenated Garrett. My husband might just use my maiden name, but so I have been in the Fruit Ridge, Stockton area for over, I was born and raised there, 50 years. I been involved with a lot with my boys. I have 4 boys, and so they played sports. So I've always been an advocate, team mother for my mom. But unfortunately, June 11, 2016, my youngest son was killed of gun violence, a third-party homicide. To that being said, it allowed me to just kind of wake up, and realize that my community was in desperate need of attention and help. So when I was approached, went to a meeting I just happened because, I'm gonna back up. Fruit Ridge Elementary School, which is now Fruit Ridge Collaborative. I went there. Jack Davis was my principal. So I was really, really amazed of how they turned, I was kind of upset that the school was gone, but I seen what they did with it. So, it kind of made me realize that things, that were there are really needed in our community. And I've been there all this time and never knew it. So once I was approached with Kim and some other advocate members with BCLC, I really enjoy the family oriented that I felt, that they was able to give me. Black Child Legacy campaign has really helped me heal, not only as a parent, but as a parent that has lost a child. I can reach out to other family members. I can, be that community outspoken person. I was able to do a couple things this past summer, work with different areas of work that was approached to me. So just to say that this campaign is so very much needed in all our communities. I could sit here for hours and just explain to you about what can be done, but we all see, we've seen the benefit, we see the outcome, we know that Sacramento, areas in the areas that are needed, with the Old Park areas, Fruit Ridge areas, Meadowview, Del Paso Heights, we are one community. And as I was growing up, because I am a Sacramento resident, not long ago, I, was able to go to different areas without all the nonsense that's happening now, my cousins. So I just want to thank you guys for just allowing us to, to have this campaign and be a part of it and support us. I also want to thank Kim, most definitely, because she is been able to, me to speak forward. To be a victim of a violent crime, it can tear one's home up. So I'm able to share my pain and heal my pain as well, but able to give it to, hopefully not, but other parents out there as well. So, and Jack Davis Park, thank this Park and Rec, because that was my park. I was
it still is your park.
Still is my park. I was telling Kim, so mad, but thank you.
Thank you, Tanya, for sharing. Thank you, Kim. Thanks, Demetrius, all of you. Okay, Ray Green, and then Ray's followed by Maisha, and then Renee. Okay.
All right, so if the whole team can come, at this time,
okay,
that'd be great.
Mark, you can come too.
So as they're making their way, I'll go ahead and get started with my
Ray, if you want to raise the podium a little bit, there's a button right there on the side. You can, if you just push it. Okay.
I don't want to mess up anything.
Okay.
So as our team is coming on their way, Lisa as well, getting ready to come on their way, we at Roberts Family Development Center and just the entire Black Child Legacy want to thank you all for making the decision to make this possible, to really make it possible. You have sparked hope again in our community, with everyone standing behind me and those who are not represented as well. You've given us another vision for healthy birth outcomes. You've given us another vision for healthy, safe sleeping babies, for those positive parent engagement in their interactions with their children, as well as providing a healthy environment physically, emotionally, mentally, and spiritually to equip our youth and families to succeed. So with that, we say thank you. With the start of 2017, we've established our home at the Greater Sacramento Urban League, room 203. You all are welcome to come join us. And we are just so excited. From there on, we've really been focusing on finding who our MDT team would be. And behind me, and some are not present here, Janelle Gonzalez being one of them with CPS, we became a family. And with that, we made some consistent and very positive strides in the efforts in helping families. So far, we've been able to reach over 25 families with the multidisciplinary team process. Now, that does not include the families that we interact with every single day, every single week. These are the families who have on our intake have had a need to have that sit-down conversation, which has been a big system change. Probation has been just wonderful in referring their services and caseload, as well as DHA. We've been doing a lot of work around awareness, education, and engagement, and the MDT team has been out at outreach, and they have had community involvement as well in those trusted things. We've added 2 CLR members. We now have a total of about 6 to 7. We have 2 new cultural brokers that are being trained at this moment, so they will not be here today, but we honor them today. We also have 7 CIL sites, which we all have been cross-community collaborative in all of those efforts. Today, you hear from some of our most trusted individuals and our most important individuals, which are our families and our service providers. So with that, I now turn the mic over to Del Paso Heights team.
Okay, great. Thanks, Ray. Okay, it's Maisha, and then Renee, and then Tamika. Or however you want to go. So,
We're going to go out of order.
Okay, all right. Okay. Got it.
Tina Roberts.
Hi, Tina.
I just want to quickly say, I've been in this work for 20 plus years. And today I can honestly say that as a community member, I am so proud that we are able to do what so many across our country are trying to do. I applaud all of you for your support, for your investment in our community. I'm overjoyed right now, and I haven't felt that way in a long, long time. But just to see the real work, the real relationships, the real partnerships, the investment in the people, I'm just so proud of you all. Thank you.
Thanks, Tina.
Mr. Chair?
I'd like to bring up Miss Renee.
Hey, Mr. Cerna, just a second.
Yeah, no, I just wanted to make mention of the fact that I was taking a picture of Tina because I needed to send it to Daryl, who couldn't be here today, to remind him who the real boss is.
Okay.
Good afternoon. My name is Renee McAllister, and I just would like to thank Black League family. I am not a mother. I'm a mother of 4 who are grown. I'm a grandmother of 5 now total. And I was blessed with my second grandson from my daughter who decided she wanted to stay on drugs, and CPS got involved. And I refused for my grandson to be taken away. Since I already had his brother, I decided to take him. But I had no resources because it wasn't in the plan. And I went to Birth and Beyond, and they made a call to Mr. Ray Green, and my phone blew up. I had car seats, diapers, clothes, wipes. I ended up in the hospital. He called to check on me while I was in there, making sure that the baby was okay with my girls. If I needed any, outreach or anything, I had somebody call and pray with me. I am a praying woman. I'm a church member. Faithful in the choir in the community in my apartment complex where I live in Del Paso Heights and North Avenue Apartments. And I just want to say that I thank God for this organization. I've only been in Sacramento 9 years. I'm originally from Mississippi by way of Monterey, California, and came to Sacramento to better my daughter who wanted to graduate from high school up here with her friends and her cousins. And this has been a journey, and I just want to thank God for allowing these guys to be a team and to be able to bless me, bless my grandson. Thank you, and God bless you guys all.
Thank you, Mr.
And just so you know, you can't see the TV, but the baby was just very prominent on the television set.
He's a star. Okay.
Hello, my name is Tamika Armbur, Sacramento County Department of Human Assistance. Good afternoon.
Good afternoon.
In all honesty, Black Child Legacy, I'll say, was forced on me. We had someone go out on maternity leave, and I received a call from the program manager and said, okay, this is what you're going to be doing now. So naturally, my response was, well, alrighty then. So I did not understand what I would be getting into, what exactly the program was at the time. But since meeting everybody behind me and going over to Urban League, where I'm stationed currently, I'm so glad it was forced on me. The only thing I wish is that it had been forced sooner, or that I knew about it sooner. The program is incredible. I know that with the call center now in play, as the other young lady mentioned that also works at DHA, just trying to figure out, okay, how is this all going to tie in? Now I understand. You don't necessarily have to bring the people to you, but you may have to sometimes go out where they are. So I'm fully prepared for battle, and with the individuals behind me, they are empowering me every day to understand my role and to get the word out. And I know that that's important. So I've sat in on the MDT meetings, only a couple so far, but just to see how the families can be impacted, just the way that they've taken it upon themselves, we've taken it upon ourselves to hold their hand through something. Sometimes the Department of Human Assistance, we're not able to technically do that. You're here for cash aid, food stamps, Medi-Cal, and if it's not that, I need you to scoot over so I can help somebody that is. So just to know that we can, as someone said earlier, do a warm handoff, a referral to another agency, and get everything all in one place, I think that's an amazing thing.
Great.
Thank you.
Thanks, Tamika.
Good afternoon. My name is Dominique Herndon. I work at the Deep Del Paso Heights in North Sacramento CIL. I help support Mr. Green in the efforts to move this work, the movement, and the initiative. And I would be remiss if I didn't also speak on the other work that I do as a PAR champion, and just tell you guys about the work of our PAR team, which is youth-led research. And they have developed the research question of how can the community stop the cycle of gang violence in Del Paso Heights and North Sacramento. And from there, they have just grown and shown to be expansive in their thinking and shown to be critical thinkers. We have developed a survey they have distributed within their community. They had an interview with the police department and the head of the gang unit. We're also going to hold, and they're going to facilitate a focus group with community leaders this Thursday. So I just wanted to make sure that you guys know that this work, especially the participatory action research with the youth, is going, it's moving, it's growing, and it's allowing them to glow and grow and just pushing them forward. I would be remiss if I didn't advocate for them and I didn't come up here and say that they're doing a wonderful job and the work is needed. So thank you.
Thank you, Dominique.
Good afternoon. So my name is Raymond Garcia, and I'm here on behalf of ARC, Anti-Recidivism Coalition, and also SARS, Self-Awareness and Recovery. We're in partnership with Black Legacy, and what we do is we hold healing circles. We also work with probation officers as far as case management, and we go out here to the communities, peace walks, and we're just a part of the community and before I continue, let me just say I'm honored to be here. I'm honored to be here amongst you and everybody in this room, as far as probation officers, police officers, community leaders, and then, city officials, people that are sitting here trying to make it happen, trying to change lives, trying to change the world and make this place a better place. We all have our position to play, and as I look at this room, I'm like, man, it's a beautiful thing when I can see you, me, and these cops all in the same room working for the same goal.
It's a good thing, Raymond.
I'm formerly incarcerated. I've been incarcerated. I've been in gangs myself, and I have a position to play in this community. You know what I mean? But I can't play my position without the support of you guys, and I can't play my position without the support of these probation officers and police officers. So just to be here and be used to make a difference in our communities is a blessing. I thank you, and we're doing it. We're doing it. The community here, we're doing it. The ones that are going to help fix our communities are the ones that are closest to it, the ones that live in the communities, and we're doing it. Believe me, we're getting our hands dirty. We're getting our hands dirty. I mean, because it's personal to us. It's our families. It's our communities. It's our babies that we're giving them our all, because that's our community. Those are our babies, and we want to see them win. You know what I mean? We want to see them live. We don't want to see them die. And I'm tired of seeing people's moms crying and babies dying on the streets. That's not what it hurts. So for you guys to support us and allow us to do our work, it's a blessing. Thank you.
Thank you, Raymond.
Hello, my name is Mark Coleman. I'm a senior deputy probation officer with Sacramento County, assigned to the CIL in Del Paso Heights, and I just can't tell you how excited I was and how rewarding the work has been so far in being out there and being part of this collaborative to not only bring services but to connect with the community out there. And when they say it takes a village, it really does take a village, and it's just really excited to see where it's going and to continue the work from that side and what this movement is doing is just great. So thank you.
Great. Thanks, Mark. Thanks for your work. Okay, thank you all. Then I guess we go to the Floor and Road folks. We have Jackie Rose, Brittany Rampy, Chanel Seipert, I believe, Elisa Burton, LaDawn Gumbas, Brianna. Oh, okay, that's I think our group. So maybe others or some had to leave, but I trust that Jackie's going to be the one to get introduced.
Good afternoon.
Good afternoon. Good afternoon.
My name is Jackie Rose, and I'm with and I'll wait for my team to get up here. We're going to kind of make this real short and sweet. My name is Jackie Rose, and I'm with the Focus on Family Foundation, and we're assigned to the Meadowview CIL. I will stand here. I couldn't stand here and tell you how excited and absolutely passionate I am about this work. I've been doing the work for over 25 years in South Sacramento, so this work means a lot for me. But I had my team standing back of me because I couldn't do it without them. They always have my back. Every last one of them that's standing up here, and some of them aren't here today, but they always have my back. I couldn't stand up here and tell you that this work is easy, because it's not. This is hard work, but it's rewarding work. I don't want to, some of the work that we've done is our CIL has gone to every CPS bureau to get the word out about the Black Child Legacy campaign. Our CIL and the Valley High CIL have what we call been on a road tour of every bureau in the county to talk about this campaign and how important it is that when they get ready to close a case, they need to do that friendly handoff of some of those families to us. And we are getting those families. Our MDT works around the clock. We have MDT meetings every Thursday, but at the same time, we knew that we couldn't do the traditional things where we open up at 9 o'clock to 5 o'clock. Our CIL stays open in the evening times until 8 o'clock in the evening. So we flex our hours to accommodate those families in those evening hours, because some of our families work. And so we want to be able to accommodate those families. And so we're excited about this work. I can't begin to thank you all for funding this particular campaign, because it's been a wonderful opportunity to be the leader of this, but I couldn't do it without all these people behind me. But as I stand here and talk, I want to be able to introduce you to our program manager, who is very hands-on. It's who you select to do this work also, who's in the trenches with you to make sure this work gets done. And my program manager works with these families where they are and moves them toward that self-sufficiency state. So we're excited about that. So I want you to meet Yolanda Stevenson, and then we're going to also introduce you to two of our families that we want to actually let them tell you what this campaign means to them.
Okay,
thanks,
Jackie. Hi, Joanne.
Hi, my name is Yolanda Stevenson, and I am the program manager for the Black Child Legacy. This work has been extremely fulfilling, and working with the community exactly where they are and impacting some of the family lives in this MDT process that we have has just been empowering, and it's been heart-wrenching at the same time, helping them get through, helping them find their power, and having them stand in dignity, and being empowered within themselves so that they can just keep doing this thing and knowing that they have support and wrapping our hands around all these babies. So in that, I would like to be able to bring up Miss Lisa Burton. She's one of the young ladies that we're working with the MDT. And Miss Lisa, come on up.
Okay. Hi, Lisa.
Hi, Lisa. Hello, my name is Lisa Burton, and that little crying baby, that was my Dylan, my grandson. Okay. First of all, he had chips against him. My daughter, she, through the whole pregnancy, she did meth. And he had to go to CPS. And I didn't know what to do. I didn't know where to go or anything. And I cried out to Sherelle. She's the pastor. And she told me, okay, we're going to get your room together for the baby, because the worker was going to come, and she wanted to see what I had for him, and I didn't have nothing. And so I cried out, I need stuff, help me. and she did an APB out there to everybody. There's a grandma out there that needs help, that she gotta take care of her grandson. And within 3 days, I had a whole nursery equipped with a crib, a changing station, and everything. Up till he was like a year old. She did it for me. And then recently, I lost my Section 8 and then was homeless as November the 1st. I didn't know what to do. And I cried out, help me. And Cheryl came and I know somebody that can help you. And then Yolanda Stevenson said, I'm going to help you. You're going to get your Section 8 back. She did calls, emails, faxes, and she didn't let up. Guess what? Yesterday I got a call. Wednesday I go and pick up my Section 8 papers. And they're gonna help me find a place and find a resource that can help me pay for the rent and deposit. Thank you.
Thank you, Lisa. Miracles come in all different sizes. So.
The next family that I would like to be able to introduce is a powerful young lady. She works for us, and me and Miss Jackie had talked with her. And she was going through some hardship and going through some challenges, so she is now one of our employees, in addition to now our MDT, and her name is Brittany Rampy, and I want to introduce her now.
Okay. Hi, Brittany.
Hello, good afternoon. I first want to say thank you to this whole board and to thank you for everyone who came and just supports this whole campaign. I've been working with youth for almost 3 years, but it wasn't until I met Miss Jackie and Miss Yolanda for Focus on Family that I actually was able to progress and work with youth and really realize my impact. Over the summer, I met a hardship. I was basically homeless. I'm still going through the process of being homeless while still trying to work with youth. I was literally at my breaking point, and I had talked to Miss Yolanda and Miss Jackie because I was being denied from the county. I didn't know what I was getting ready to do, and my biggest thing was, how am I going to try to help other families, and I can't even help me and my 4-year-old daughter right now. Once I opened up to them, everything changed. Like, I can't even express how it feels to have a support of other human beings, of other adults in your corner to make sure that you're not going to fall, that you're not going to fail. It's so easy to give up, and I was at my breaking point. I was going to quit. I was just going to stop. And then that's just even more of a downfall. I was getting ready to be in a circle that I was not going to be able to get out. Just talking to them, Miss Yolanda, Miss Jackie, it's a constant, they're always checking on you. The fact that hopefully by Thanksgiving, me and my daughter will have a place again, that support there has literally made a difference in my life. And I cannot express even how much I feel right now. Being here is emotional for me. I never even imagined getting this opportunity. I hug them every day, and I cry. I always tell them, I'm like, oh, you're gonna make me cry, because I didn't have the mom support and my dad support. So the fact that this whole organization, and then just to get it from you guys as well, it means a difference. Thank you. Seriously, thank you. Thank you.
Thanks, Brittany. Good luck to you. Okay, okay, good. Well, thank you all for being here. Thanks, Jackie, Liliana, Brittany, Lisa. Okay, next I have,
I am so sorry, I'm out of order. I was just told I was supposed to come up here.
Okay, all right, it's okay.
Hi, I'm Pastor Sherelle English.
Oh, Pastor, okay.
And I'm a proud member of BCLC as a community leader roundtable. And I have 3 words that actually identify this organization. The first being one voice. As a past choir director, when you have all the choir members together, you always say you want to hear one voice, one movement, one goal. And that's what you see behind me. It's a collaborative effort of transformed minds that renewed themselves in such a way that they said, we see one common goal. How do we take care of our children? And you don't see any pompous attitudes. You don't see any I want to bring myself up higher than you. What you see is, how do we get to the main solution? I'm blessed to be able to support any CIL that needs me. I come out of Meadowview today, but I have worked with Del Paso Heights and had the opportunity to get 2 young men cleats so that they could play in their football league. Okay, I've had the ability, as Lisa said, to be able to make out a call and see everyone come together in the community to make sure that that baby had everything it needed to be okay. You know, I have had more opportunities to be available than ever before to our community, to our youth, and to this initiative. And I'm really grateful for that, because initially my next word is hope. I'm a recipient of one of the many grants, and I lead an initiative called JA Moneymakers out of Dyer Kelly High School, Dyer Kelly Elementary, trying to watch the clock, in Arden. And this little girl said, wow, somebody really cares about me. And they have hope. They want to be scientists, they want to be teachers, they want to be police officers, they want to be soldiers. And to know that we're coming out and saying, yes, this really can happen. There is change, there is hope, and it's available. And it's available because we have one voice, and today we have a solution that we can really be active on. I just want to say thank you.
Thank you, Pastor Amish, for your Okay, I believe next, Brianna Davis and Gary Young, Tasha Johnson, Les Simmons, I think, following. Good afternoon.
Good afternoon. I'm not Brianna Davis. But I am Lamar Thorpe, and I serve as Vice President of Development and Communications for the Greater Sacramento Urban League. And when I first started here 5 months ago, I inherited the Black Child Legacy in Oak Park. And then we went through some transitions, and we then brought on board the real Brianna Davis. And so we're excited to have her. I will add that I want to thank, and I didn't get your name, but I want to thank you for sharing your story about your grandson.
Lisa Burton.
Lisa, I want to thank you for sharing your story about your grandson. I'm often asked, what did I study in college? And I politely respond with women. And some of you are giggling, but I actually do have a master's in women's studies and a bachelor's degree in sociology and women's studies. But since college, I've always worked in higher education as a fundraiser, so I've never really had the opportunity to use the real work that I was trying to do in women's studies and community work and advocacy to use. And so when I came here and took this job, I inherited the Black Child Legacy campaign, and there is no greater honor than serving in this role and doing the work that we do in in Oak Park. And it's passionate, and I'm passionate about it because, like your grandson, my mother was a heroin addict when she was pregnant with me, and so as a result of that, I was actually born in prison and raised in foster care. So I'm excited about the work that we're doing here today, and I'm excited that we're working on this collaboratively. And so from there, I will turn it over to our lovely leader, Ms. Brianna Davis.
Thank you very much.
Yes, so I am Brianna Davis. I'm actually the new CIL lead for the Oak Park community. I'm so excited about all the things that we're doing. We're building new partnerships. We're gaining new CLR members. So community members are coming in, they're getting trained, and we're just really excited about the growth that we've been experiencing. Another aspect that I'm really excited about is our MDT process. We are building partners and really collaborating with other organizations and community partners. So to talk really about what we've been doing and the impact that we've been making, I have a couple of people that I want to speak. One is Pastor Gary Owens. He is one of the faith leaders that is involved in our peace walks. And then I'll also have Melissa Hill from WellSpace talk about our MDT process and some of the stories that have come about in that process, and also Tasha Johnson, who is our youth development manager for the Urban League.
Okay, Pastor Gary.
Amen. Actually, it's Pastor Young, Gary Young.
That's what I thought. Yeah, I thought it was Gary Young.
Was it on there?
Okay.
Okay. The New Hope Church, Baptist Church in Oak Park. I actually represent a collaborative of other pastors who have joined this effort with the groups involved. They couldn't be here. Pastor Terrell Jones, Pastor Anthony Sadler, and Reverend Dr. Ephraim Williams. And for a number of months, we've been joining with these groups in the Community Peace Walk in Oak Park because we recognize our shared interest. Our churches are located in the communities, but the realities are most of our congregants drive into the community. So we do have a common ground with the persons who live in the community to make sure that the peace, the violence stays down. And so we've been doing this for a couple of months. We have a group out of our church that actually have been doing it over a number of years on Fridays to walk in the community. Key word that's been mentioned here today a number of times has been the word relationships. And what we found is that we've initiated relationships with persons in our communities that we didn't really know were there. We are benefiting by those relationships. I think our churches are benefiting by the relationships, and certainly our communities are benefiting by the relationship. I want to thank you and all the groups necessary for the opportunity to be able to say a word about this very positive effort.
Great.
Thank you so
Pastor
much.
Young. Okay, next.
Hi, my name is Tasha Johnson, and I'm the Youth Development Manager for the Greater Sacramento Urban League.
Tasha.
And one of the many hats that I wear is going into vocational high schools to train students on job readiness, career exploration, and just preparing them to enter the workforce potentially after graduating from high school. So in my position, I was talking to a young man, and he didn't know what he wanted to do, so I'm asking him a million questions. I used to be a middle school teacher. So I'm asking him a lot of questions, and he's answering, and I asked for his address, and he was like, Miss, you don't want to know that. And I was like, I kind of do, but if you don't want me to, it's okay. So he finally told me that he was homeless. And so, kind of switching hats, I think I physically spun around in the chair like, so, would you like help in that? And he answered yes, and so I walked him through our MDT process that we have in the Oak Park CIL, and got all of his information, and through that, the team in Oak Park was able to come together and get him clothing and get him resources to access housing and shelter. And he is a vulnerable youth. He's an African American male in the targeted population that falls into all those different traps that are set for him, and he's refusing to do so. And he was supported by us in bettering his position and his situation. So the following week after I saw him, he came to the CIL. Hey, and he felt really welcomed and embraced. The following week, I presented in his class, and he was the only one that knew who the Urban League was. And again, this was a different hat, not the CIL hat. And I'm introducing ourselves, and I was like, hey, do you want to share what the Urban League does? And he was like, yeah, they find people houses for homeless people, and they really help you, and they give you clothes. And I'm like, kind of. So he was really excited to share the help that he got, and he was actually educating his peers on not just what's out there as resources, but what the issues are that others face within their peer group. So I'm really excited that we're doing this work, and the Oak Park CIL is committed to this work with everyone else.
Great. Thanks, Tasha. Thanks for sharing.
Hi, I'm Melissa Hill, and I'm the program manager for the WellSpace Health Cultural Broker Prenatal Support Program. We are very happy to be partnering with the Oak Park SIL and also the Meadowview SIL in helping them with any pregnant woman that comes in and needs services. I was attending an MDT meeting at Oak Park, and the CPS worker had a referral for a woman that was probably about 33 weeks pregnant, had been dismissed from a couple different OB practices in Sacramento, and so I was able to go back in, get her fast-tracked into prenatal care with WellSpace Health. She signed up in the Cultural Broker Program. Her prenatal support advisor went with her to her first 2 visits because there'd been issues with her and office staff in the past, and I'm happy to say she's getting all the services she needs. And I also got to see at the SIL that she was also getting services from SETA and from DHA, and it's just really great that we're all delivering the same message to these women, and we're just really happy to be a part of this. Thank you.
Thanks, Melissa. Anyone else? Oh, I guess that's got it. Thank you all for sharing. Thank you very much. Okay, then next I have Les Simmons, or Rachel Francios, Antoinette Clark, Paris Dye. Okay. Was that the luck of the draw that you get to be one of the last teams, or no?
Yeah, that's the draw. And then
I didn't shuffle them, so I'm sorry.
Then I'm also the pastor as well, and typically I go at the end of service and am doing an altar call, but I would say we're all saved in here. And I think we need to do some work to lead the rest of the country. As Chet talked about, the only 2 counties are actually doing this work, and this is sacred work that we're doing. To see it happen on a daily basis at the Valley High CIL, as well as the 6 other community incubator leads spread out throughout the county. This is the sacred work that I feel we're called to do to save lives. I see it happen on a daily basis through the MDT meetings that are happening, bringing together grassroots community organizations, as well as our city and county services to really do case management, strong collaborative case management, as well as on big events. One of the things that I'm really excited about are the family skate nights that we sponsor through our Black Child Legacy. We hold them in the old historical Cal Skate building in South Sacramento, where we see through our program manager, Katrina Simmons and Nanette West, bring together from anywhere from 100 to 150 individuals and really advocate for Black Child Legacy, as well as offer alternative to violence conversations. Another thing that excites me about the work that we're doing is really creating a baseline for first responders within Sacramento County for us to not only respond in gang violence and third-party homicide situations, but to be able to also interrupt violence, which is a key part of stopping the violence within our community through rumor control, through strong advocacy work as well, though that work is happening. I want to just quickly introduce not only some of our team, but some of the folks that have signed up to speak, some of our youth advocates as well. One of them is very precious to me. I've seen this young lady go through some traumatizing events, losing her sister to cancer, losing her mom to cancer, and losing her grandmother to cancer, but now is in this work of saving lives and building a legacy for the next generation. That's Rachel, and she's going to just speak on the youth piece as well.
Okay, thanks, Pastor. Hi, Rachel.
Hi, I'm Rachel Francois, and I'm a youth leader for the Valley High CIL. I'm in the Valley High area at least 3 times a week with family, friends, or just helping in the community. And whether it's participating in PAR, the Legacy Camp, or even just working the booths at different events for Black Child Legacy, the Black Child Legacy campaign has helped me come out of my shell more and become more of a leader. And not only has it helped me realize my potential, but in that, the Black Child Legacy campaign has really allowed me to get involved and to be a part of the solution because it is centered around the youth, and if youth don't get involved, then our legacy and the legacy of this campaign won't ever continue to grow. And as a youth leader, I understand that it is our responsibility to carry out this legacy forward and to save our babies.
Thank you, Rachel.
Hello, my name is Nanette West, and I actually am so pleased to be able to speak in front of you today. I have lived around the world and throughout this country, and I have never seen anything like this. When I look at the word awesome, I can't help but think of Black Child Legacy. I was not purposely, I did not bring myself into this work. I was being obedient and was brought on by Pastor Les and his wife, and I have been running with it ever since. It is such an honor and a joy to work with my community. I work in Valley High. I attend church at Valley High, in the Valley High area. I live in Valley High, and I shop in Valley High, so Valley High is my home. I am from Sacramento, born and raised, and I am very, very proud to be a part of Black Child Legacy, and I can't wait to see what it has to offer our next generation, because this is just awesome work that they're doing. And thank you so much for supporting this. You guys are doing awesome work as well, so thank you. We appreciate you guys.
Thank you, Annette. And thank you for answering Pastor Simmons' call. So.
My name is Antoinette Clark, and I'm at the Valley High as a community lead of the Round Table. And being a part of, I think that this is an awesome program. I have a youth that was in trouble a little bit with the law. And when I got the call to go out there, the youth, and they were talking about leadership and things that we can do, and I said, oh, well, I'm part of the Valley High program at the incubator lead, and they were like, you know what, I know that program. And before I can get away, I got a call from the probation officer asking me, did we need any help with the situation that we had there? I thought it was really eye-opening to be for them to be so active so fast to get my son in the services that he needed. It was really a great program that I thought, and me being a foster parent, when I went through the whole little system with adopting my younger brother and sister, the sources wasn't out there for us. We were confused, and at first I was turned away. They were like, oh, you're too young for this. You already have kids. That's what I was told way back then. I wish this program was implemented then, because it is amazing what they can offer you and send you in the right path on things that you can get to make our lives better. And I really appreciate you guys advocating and supporting it, and we really appreciate it. Thank you.
Thank you, Antoinette.
And we have Jacqueline, who's on site, part of our MDT. She's an amazing person. Please.
Well, thank you very much, sir. My name is Jacqueline Ingram Duncan, and I'm an informal supervision CPS social worker, proud to say. And it is an honor that I stand before you today and to work with such marvelous, compassionate people for children. It does take a village to raise a child, but it takes a village to raise a family, and that never ends. It's a lifetime. So we have like a real life story about a 56-year-old gentleman that called in one day, frantically calling. He needed help with his wife and his two-year-old daughter, and he couldn't see that he needed any services or needed to make any changes himself. And so he started talking about the wife, what she was doing, asked me, well, did I speak with her? And I said, yes, sir, but with all due respect, the two of you are saying the same thing about each other. And so he said, well, can I run in, and where are you located? I gave him the address, 7710 Stockton Boulevard, South Sacramento Christian Center. He came on in, rushed in with his 2-year-old daughter, and he was speaking with the pastor for 2 hours. And when he came out, well, of course, we provided daycare services for the 2-year-old. And by the time he came out, he could see that he really needed to focus more on himself and his individual, just things that he needed to focus on for as a human being that he couldn't see before. And so he thanked the pastor. The next week he was out at church with his family, and that was earlier in the year. And today I still see him at services, just engaged in services, strategies for change. He's drug testing, he's taking parenting, counseling with his wife. They have a new baby, and he weighs me down, and he says, thank you so much for helping me. You guys are doing such great work. I'm 56, and I finally feel like I'm grown up. Thank you so much.
Thanks, Jacqueline, for sharing.
I think that's it as far as, unless you have some comments. This is our.
I'm trying to keep it short.
Okay.
Everybody have said it all.
Everybody said it all, but again, thank you, County Board of Supervisors, for you believing in our legacy and supporting Black Child Legacy, and then to the steering committee for the reduction of African American childhood death. Thank you guys for really making an effort to bring everybody together. You guys are some heroes, and we love you, and thank you guys so much. Thank you.
Thank you, Pastor Lester. Okay, I have some others, and some of these may have spoken already. They were, but I have Paris Dye and then Audra Sip. Okay. Oh, I'm sorry. Okay, and Bentley Callender, you didn't speak yet. Nope. Cynthia Matthews. Okay, come on down. Oh, okay, great. And then then we have Demore Jackson and Alma Cover. Okay.
Split Hill Farms.
Very, very patient you all are, so.
Does that work?
Yeah, well, yeah, we just put the screen up? Yes, we can get that. Sure.
Good afternoon.
Good afternoon.
My name is Cynthia Matthews, and
hey, Cynthia.
I recently retired from the state of California in June of 2016, and before I retired, my sister told me that you're going to be helping me, so I'm pretty much volunteering. And also, as a small business owner, my husband and I own American River Home Inspections, so home inspection business. My role as a partner, a community partner, I've participated in quite a few things, such as we had. The first thing I went to was a Make It Matter conference with women, and I facilitated a goal-setting class. I'm trained. I was a trainer at the state, but I did soft skill courses, mainly personal development, and also skill building to get jobs, employment. So in the Make It Matter conference, I facilitated the goal-setting class and helped the people identify goals in their lives and what they wanted to accomplish. Also, I've facilitated a roundtable discussion for our employment readiness program, and it involved community leaders and business owners, and also people just in the program. And we came up to develop components for our employment readiness program. And we have Steve Garrett from the Public Defender's Office, and also Marlon Yarbrough from Probation, who attended that meeting. Okay. So it was really good. And out of that meeting, we developed certain components that we needed to get ready to start helping the youth get jobs. Okay, so with that, I led a resume writing class, and we're preparing to help with interviewing and dressing for success, all the components to take to help people get jobs. Since I had mentors throughout my career, I felt like this is a wonderful opportunity for me to pay it forward. And I'm very happy, and thank you for your support in this. We also participated in a healing circle, and that's when I really realized that we need help, and it's it's so many people out there who need help. In that healing circle, we had a variety of people. One was just shot walking down the street. Her dad was with her, but he didn't get shot. She just got caught up in the gun violence. We have one young lady who lost her mom, and she's only like 19, 20 years old. Another one was robbed at her job and beat down. An ex-gang violent member, and a mom who lost her son. So it just had a wealth of everybody in there who needed some support. So I felt that healing circle was great. We ended up doing a painting with an organization called Paint Like a Butterfly. And so it was a great bonding experience, and to let the people know that we are here to support them. And they were very appreciative that we were there. I've also been trained to provide training for the Safe Infant Sleep program. And with that, we wanted to tie in our business, and my husband is willing to visit the homes of the families to make sure that their homes are safe, because sometimes they don't know about the wiring with their cords or just simple safe living. So with the Safe Infant Sleep program, we want the whole family to be safe.
Right.
So with that, that's our contribution.
Thank you,
Okay,
Cynthia.
thank
good,
you.
Good. Are there others? Confirm? Yep. Thanks, Cynthia.
Hi, I'm Paris Dye, and I have the privilege of working with the North Highlands Foothill Farms Community Incubator Lead. I love the work. I love the county partnerships with the MDT and the other people that are involved from the whole work from the top down. I get to call a lot of people. I have more work husbands and work wives than I've ever had before because of the responsiveness that happens. So we do quite a bit of work out there in Foothill Farms and North Highlands, spreading awareness. We attend community events. Our partnership with Twin Rivers School District has opened doors. We are wide open to the high school, to the elementary schools. We do a variety of pop-up parties and different things where we educate people. Hold on, here you go. Part 2. We participate in a lot of community walks. We've done peace walks where law enforcement comes out. We host events at our location like Neon Night, where we have an opportunity to reach about 400 families. We fed the football team. Food is really important. 2 years ago yesterday, we lost J.J. Clavo while he was out trying to get a meal before football. So we were able to partner with the school and take the kids' stuff. We loaf an 800-pound bounce house around to our places and community events. When you have 3 people and an 800-pound slide on a truck, you hope to get a lot of attention, and it does. It just brings out lots of people, healing circles and all of that. But it's a great privilege to be here, and our team is going to be swift and as quick as we can to share what we do.
Okay, thanks, Paris. Okay, next.
Here comes Littles.
I'm nervous, you guys.
Don't be nervous.
I don't do this. My name is Audra Sipp.
Hey, Audra.
I started going recently. I lost my son to gun violence last year. It was the worst day of my life. Now I'm taking care of my grandson. I'm sorry. It's really, really hard for me still. All I used to do is sit in my room and cry and tell God I want my baby back. And I wanted to give up, but I can't because I have 5 more sons and I have 7 grandkids. But I love Paris because she called me to the program, and I go down there and we sit in circles and we talk and we express our feelings, and I get to cry because I try not to cry at home. I try to be the big mother and not cry in front of my grandbaby. So I get to cry, I get to paint, and at the end I feel really good. But they're here, they support me. Like, my family don't call and check on me and nothing, so if it wasn't for them, I don't know what I'd do. I'd probably be giving up and crawling in a hole, or sometimes I just want to die, but it's not an option. So I just want to thank them, and I want to thank you guys for this program. I wish it was here a long time ago because I was a young mother. When I was 23, I had 5 kids. I was homeless, but now I'm a homeowner. And I've been married 29 years. Well, not married, but with my kids' father. One day it might happen, you know, Paris will marry me, you know, maybe.
Audrey, that's on television, so you just told the world about
so
it.
much. I just want to thank you so much, and I want to thank you guys for being here for me. I'm sorry for always being a crybaby. They gave me my nickname, Puddles, and it's fine. I'll be Puddles. God bless you guys, and thank you.
Audrey, just for our next speaker, when you sign up, you put what you're going to speak about, and a lot of folks didn't do that, but you put, I wish to speak on the following subject that is not on the agenda. I think it really was. And you put healing. Healing, that's right. And that's right, just you spoke to, getting better.
Thank you.
Thank you. Okay. All right.
Good afternoon. My name is Alma Caravarin. I am a volunteer at the Liberty Tower CIL. I specifically work there with the Participatory Action Research Team, which is the group of youth for our area. The youth there actually come from both District 3 and District 4. So I like to really share the news with you about this amazing group of teenagers. We have 5 of them right now. They've been meeting since June. On a weekly basis, they, at the beginning of the school year, actually, they amped up their commitment to this project, and they started meeting twice after school, which I know is actually like a challenge for them because they're trying to balance other activities, and they support their families in different ways. But after they have experienced, and they have been informed and educated on the issues that are happening in Sacramento, and specifically in their neighborhood, they have been really energized and really developed commitment that makes me really proud about the work that the Black Child Legacy has been able to do in our communities, because it really has activated these youth. You can see some of their faces there. I think it's mostly the girls there, not the guys. But they have been really committed to the work. They have been working on the question, out of all the things that they really found out in information, what they were more interested about, because of the feedback that they got from their peers, was on how third-party violence and third-party homicide is affecting the youth in their area, in their schools. Where their question is, the research question is, how does miscommunication and conflict lead to violence? And in addressing this, they developed a survey. It has been really, really hard process, but they have really stepped up to the challenge. They introduced the survey, so really with a lot of encouragement, a lot of the technical support, technical assistance support team has been meeting with them, and they developed a survey that they introduced to two of their high schools. So they administer 1,158 surveys on one high school, and it's over 500 on the other one, which they're going to continue to analyze for data. But they're very excited on educating the community on these issues, and they are very excited. They will be very excited to present to you guys their findings. They've actually continuously been getting some feedback and some support on how to develop some of those public speaking skills and so on and so forth. But I know that I'm a little bit past my time, but I really wanted to make the connection to how the participatory action research is really has been benefiting from the increased capacity that the Black Child Legacy campaign has been able to help our organization, Liberty Towers, as a church, as a CIL in our area. One of the trends that we saw in one of the graphs that I believe Dr. Evans had with the indicators and risk was that poverty is one of those things that continues to be there. It's one of the highest things that continue to go up, and at 68%, I believe. And I think that we recognize at that site how investing in the youth in what is economic prospects and job development is actually going to be an investment to address all of these other things. And the participatory action research team is really identifying those as possible areas and where they want to continue to work and expand this research project to be an after-school program for their high schools.
Great. Thanks,
Thank
Alma.
Hello, I'm Mark Johnson, long-time listener, first-time caller.
Call again.
Yes, so I'm different. I don't really work too much in the community. I work at Home Depot in Carmichael, but I do a lot of my work there for the community at Home Depot. And I've pretty much got into the employment readiness experience, getting in touch with paroles and the sheriff department and a bunch of other businesses on how to help youth that are neglect and abuse get a job, and not only get a job, but keep a job. So I recently, pretty much, the first 2-3 years at Home Depot, I was just joking around, having fun, and then eventually I decided I wanted to promote up. And I had to, on my own, figure out who to talk to, how to promote myself in a way so I can move up in the company. And once I figured out how to do that, I pretty much started mentoring kids and people below me. And my first was a minority girl from Guatemala, taught her what to do as a supervisor, who to talk to when you wanted to interview, how to do that, how to make sure you put yourself in a position to when a position opens up, how to get it. And then once I moved up on, she was able to get my position. And then from there, I started working more with the Lotta associates, which are about 18, 19. Like right now, I have one that just graduated from Center, another one just graduated from Del Campo, another one just graduated from San Juan. And how to help them move from the lot to on the floor, which is a little bit of a pay raise, how to exceed there. And also started working with my mom, Miss Paris, on high school kids and how to interview. A lot of times their parents will tell them to go out and get a job, but they won't tell them how to get a job. The difference between saying ask and ask, how that can take you so much further in life. So that's why I love Black Child Legacy, is because it's not just Black Child, it's all children. And they're all walks of life, and a lot of times they just need a slight helping hand in order to move on and to grow and become bigger. So I don't too much go into the community. I help where I can, and I do a lot of work at Home Depot, and I help a lot of people that way. So I don't want to keep us waiting because I'm hungry. So thank you.
Thank you, Mark.
Oh, this picture too.
Okay.
I'll look good in this picture.
Very good. Thanks. Okay. Next. Good afternoon.
Good afternoon. My name is Bentley Callender, and our company is Callender Insurance Services. We're an insurance broker, and we are part of the incubator team in North Highlands and Foothill. And what we do is we assist really anyone that comes to us, but we assist with helping people enroll in healthcare coverage, which is really important to what we're talking about here. We also assist with mentorship and engaging male youths with the Employment Readiness Program and entrepreneurship. One of the things that we're talking about here and listening to a lot of the stories and testimonials, we're really talking about relationships here. And I think this is what's great that the Black Child Legacy is bringing to the community. And personally, and I think there's a lot of studies out there, stress is such a huge contributor to things that go wrong in the community or in society. And one of the things that this is doing is helping lower the stress level. It's giving people an outlet where to go to find the help that they need, which is really, really important. And bringing awareness to the community. One thing about what we do as a company, and a lot of people don't know this, is that it's not just us, but it doesn't cost anyone any different to purchase healthcare coverage if they go through an agent or broker. It's the same price, but the thing that we can do is help navigate the system. Even after someone buys a policy, we still help them navigate the system. So that's one of the things that we're bringing to the North Highlands Foothill Incubator.
Great.
Thank you.
Thank you, Billy. Okay.
Hi, my name is Hasneen. Most people call me Peanut. I'm the DHA Human Services Specialist that's associated or outstationed at Liberty Towers. So anybody that comes in the door, whether they're Black Special Skills caseload assigned to me or not, they have questions about CalWORKs, food stamp, Medi-Cal, GA, I know all the regulations, and so I'm there to navigate, to help them basically know what program ins and outs of what they may need for them, individuals and families. The other thing I really like this program is I've been with the county for 12, going on 13 years. I've always been some kind of public contact worker. I've been clerical for a long time. Then I was HIS, doing all levels of the job, and I was a job club facilitator before I came here. So one of the things that I really like is that when you take that element of, oh, you're the government, that stigma that people don't want to talk to me because, oh, well, you're the government, you know, we don't trust you. But then, you know, when it's just, when you take the eligibility element out of it and you can talk to people person to person, you really find out, you know, what kind of issues and situations that they may be facing and that fall in the category of what we're doing. And so I really enjoy it. All of my coworkers are hating. They're at the bureau and they're in the service center design model. They're so jealous. But I'm really glad that I was able to take this position because I really want to be able to reach out to the community, and this is my chance to do it.
Great.
So thank you.
Thank you. Okay.
Hi, I'm Ross. I'm obviously with the North Highlands Foothill Farm CIL. I've been working in the North Highlands Foothill Farm area for about like 7 years now. And I guess I kind of want to talk about like what it was like before the Black Child Legacy campaign and like what it's been like after that. I got notes. I'm like, when I first got there, right, there was kind of this narrative, again, our area is unincorporated. So like, you know, you guys are our only real representation, right? So the narrative was that we're kind of a forgotten area, right? But now with this campaign, we feel connected to the whole county. We feel like we're part of something bigger, and I see it with the youth especially. They feel empowered, they feel like they're part of something bigger, and they actually feel like they can make a difference. And so I'm seeing that like narrative change. And the other thing that like I've noticed is, you know, we have worked with a lot of families. You know, like one family came in, the guy was asking for money. We were able to get him a job, you know, kind of get him some support, and he's moving forward. But then he moved to the south side, you know, so our services didn't reach out there, whatever, and he couldn't make it back. So he kind of lost touch, he lost that support, and the guy relapsed, right? Now, with our network, with Black Child Legacy campaign, we can be like, oh, you know, you're moving to the south side. Oh, I know some people out there, right? Like, let me give you a handoff to them. You know, oh, you're moving to Del Paso. Oh, like, let me give you a raise number, right? So people, as they move around, can still stay connected, still get that support. And I think that has been some of the big changes that I've noticed from this for the people that I've worked with and with the community. Thank you.
Thank you, Ross. Okay. Okay, thank you so much.
Peanut and puddles.
Thank you guys again.
Great, thank you. Thanks, Mark. Okay, hopefully I didn't miss anybody. I've got two other slips here. I have Elianne Murphy, and is it Demore Jackson? Demore Jackson?
Lamar was with the Urban League, and Elianne had to go.
Okay, all right. So did we get everybody covered? Is there anybody else that didn't get a chance to speak that I may have overlooked? If not, it's been a pretty powerful morning and early afternoon with all the sharing of stories and the good work that's gone on, certainly in the Black Child Legacy Project. So with that, I don't know if there's any other comments by board members. If not, Mr. Cerna, Ms. Peters. Phil, yeah, Phil, you punched up first.
So, thank you, Mr. Chair. Yeah, I always actually can't wait to hear the progress that's being made on this important front from everyone. We hear it now on an annual basis. I tend to be a little closer to things on a more frequent basis, just because I'm checking in with Chad or others about how we're implementing our planning objectives. But it really is the stories we hear from mothers and grandmothers and those who have lost their children, and you know, some of it's difficult to listen to. It's very emotional, but to know that we have this effort that is so sincere and well thought out in this county, I couldn't be more proud. And I couldn't be more proud of my colleagues too, because this is not about one single individual. This is about the county, its infrastructure, its people, its elected leadership, working together with our nonprofit partners, working closely with certainly the Sierra Health Foundation, and so many other organizations to do and to achieve something special. And I think, as the chair mentioned earlier, this is really about measuring the most important aspect of what we do collectively, and that's saving lives. So I Mr. Chair, I'm just a little bit overwhelmed in a good way. And I want to commend everyone that had a small role to play, a big role to play. I want to certainly encourage those that perhaps are watching that don't know much about the effort to do some research, do some homework. I suspect they can probably just do a Google of Black Child Legacy campaign and find plenty of information to lead them in the right direction. I would also encourage all of our offices to get a hold of extra copies so that we can share the information directly, the hard copy materials in terms of the annual report with our constituents. And again, I just want to thank all of our, certainly our county employees, our various departments, probation, DHHS, DHA, and everyone else that's been part of this incredible effort. Thanks.
Thanks, Bill. Sue?
Okay, thank you. I just I wanted to say thank you to Sierra Health and the county departments, all of them, for this incredible effort, the way it is integrated between government and a private nonprofit. The teamwork that is shown in setting up all these different centers and everyone who's working there. I cannot believe the respect and love that I heard today. It's not always what happens here in this board chambers. The enthusiasm was palpable, and I really am coming away from this very positive and feel like all of the people who spoke here today are going to make a difference for future generations. So thank you for your work and dedication. Thank you.
Thank you. Okay, Supervisor Frost.
I just want to echo the words of my colleagues, but also wanted to thank the county staff for all that you do. You've changed the way people look at CPS and human services and government, and I think it's amazing what you do. And probation is always there. Thank you. But to the community and Black Child Legacy campaign and to all the partners, thank you for your compassionate leadership and for the hope and support that you bring to the community. And I'm new to this board, so I don't know all of you, but I'm looking forward to supporting your effort, and I think you folks are the closest to my district, so I'm looking forward. I just signed up for your email newsletter online, so let's connect. So thanks for all that you're doing. I appreciate all that you do.
Great. Well, again, thanks to go around to everyone, certainly my colleagues for their comments and certainly the support of this board, but the support of the broader community. And it's an incredible effort that's going to have remarkable results. And I think today was a real testament to all of that. So with that, again, thanks to all who stayed with us through the presentations. Again, very important, very powerful. And I know good things, many good things lie ahead. So thanks again. And with that, we could conclude the morning session, and we're going to take a break. We said we'd be back about 2:30. We'll say like 2:40 now. We need about 40 minutes. We'll have a closed session during that intervening time. Is that correct? Is that the plan?
What I was going to recommend is to come back at 2:40, have close, and then come back and open.
Okay,
our
can we
closed
go?
session.
Can we go directly to closed session at 2:40 then, and come back? We'll adjourn for a brief recess for break. Come back. We'll go into closed session at 2:40. Return here.
Right after that, yep.
Right after. So the afternoon will get bumped for those who have been showing up now for the remaining morning item, and the afternoon items will be through the afternoon. So there'll be some reshuffling, not shuffling, but just going to push stuff down. So, okay, so we'll be back in open session roughly around 3 o'clock or so. So.